The Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria, PMG-MAN, in collaboration with GPE Expo PVT Limited, presents the 6th Nigeria Pharma Manufacturers Expo, Nigeria Lab Expo 2022. Theme: Advancing the Frontiers of Medicine Security in Nigeria. Expanding local pharma manufacturing in the era of AFC-FTA. Keynote address speaker, Dr. Walter Pizadi Mulombo, WHO Country Representative in Nigeria. Special presentation by Mr. Francis Anatogo, Senior Special Assistant to the President on Public Sector Matters and Secretary Action Committee on AFC-FTA. Host, Dr. Fidelis Ayegbai, Chairman PMG-MAN, CEO Managing Director, Fitsin Healthcare PLC. Chief Host, His Excellency, Mr. Babajide Sanwo-Olu, Governor, Lagos State. Chief Guest of Honor, Dr. Osage Ehanire, Honorable Minister of Health, Federal Republic of Nigeria. Date 18th to 19th October 2022. Venue: The Haven of Akinjobi Street, Archbishop Vining Church Compound, Ikeja, GRA, Lagos, Nigeria. Time: 9 a.m. daily. This hybrid event will be streamed live on PharmaStream TV, Facebook, and YouTube channels. Subscribe to these channels for live notifications. Announcer: Pharmacist Patrick Aja, Chairman, NPME, MD and CEO, M&B Nigeria PLC.
Are we live? Good. Good morning, Your Excellencies, distinguished ladies and gentlemen. You are welcome to the 6th edition of the Nigerian Pharma Manufacturers Expo 2022. This Nigeria Lab Expo is put together, organized by the Pharmaceutical Manufacturers Group of the Manufacturers Association of Nigeria, PMG-MAN. In collaboration with GPE Expo, EVT Limited, and proudly supported by a body who is engineering the future. I'm talking about the EEPC India. So once again, you're welcome to this epoch-making event. And we proudly say, I hope my mic is, okay, good. And we can proudly say that this is the biggest and the largest exhibition of Central and West Africa on complete pharma manufacturing. Of course, the ambience, the arena for unparalleled business networking opportunity to meet all relevant professionals in the industry all in one place. So once again, you're welcome. The theme of this year's edition is Advancing the Frontiers of Medicine Security in Nigeria, Expanding Local Pharma Manufacturing in the Era of African Continental Free Trade Area. I am pharmacist Charles Aigbona. I will be the anchor of this event. I would like us to begin by populating the high table. And I have a list here, after which we can proceed with the program. I think I should invite the landlord, more or less, that's the chairman of PMG-MAN, to be first on the high table so that he can warmly welcome all the others I would introduce afterwards. I'm talking about a fellow of the Chartered Institute of Corporate Affairs, I think I just been updated on security situation and to say that everywhere is calm and then we can proceed. So it's about inviting okay, all right. All right, so the chairman of PMG-MAN, Dr. Fidelis Ayebe. Please, a round of applause for him, please. The chair, you're welcome, sir. The chair. The head of protocol of Government House has reordered the protocol we arranged, so I'll just follow the orders from above. All right, thank you very much. Next is the ministry that we are loyal to. I'm talking about the Federal Ministry of Industry, Trade, and Investment. The Honorable Minister is ably represented here by the Director, Francis Honora. Francis Honora, please. A round of applause for him. Sir, you're welcome. You're welcome to Lagos. So move over to the next ministry, the Ministry of Health. And the Honorable Minister of Health, Dr. Osaige Ehanire, is ably represented here by the Director of Food and Drugs. Please join me to welcome pharmacist Olubumi Arebana. Please. Thank you. So move to the pharmacy sector, and I'll go straight to the Pharmacist Council of Nigeria, and there I'm going to the apex of the council. I'm talking about the Governing Council. And right here, ladies and gentlemen, we have the chairman of the Governing Council of the Pharmacists Council of Nigeria. Please join me to welcome a handsome man, Professor Mora. A round of applause for him, please. Please, a round of applause for the Master of Ceremony. Please, can we clap for the Chairman of the Governing Council of PCN. Talking about the pharmacy sector, I will move on to the association, to the society. I'm talking about the Pharmaceutical Society of Nigeria. And here we have the #1 citizen of that society. Please join me to make welcome to the occasion as he moves to the high table, Professor Cyril Osifo. Professor Cyril Osifo. Ushers, where are you? You are playing with your balance, I can see. Presido, you're welcome, sir. And the World Health Organization, the representative in Nigeria, who is going to be doing for us the keynote address. Please join me to welcome Dr. Walter Molumbo. Dr. Walter, please. This way, this way, this way. Yeah. Just use the GPS, follow the arrows, and there you are. Our mama is here, the Director General of the National Agency for Food and Drugs Administration and Control, NAFDAC, Professor Mojisola Christiana Adeyeye. Please, madam, you're welcome. Yes. Should I carry your bag? It's not, okay, all right. I see you traveled light, ma'am. You're welcome. We are delighted to have you in our midst. Thank you. So this being an international event, let's give it an international flavor. Let's invite the High Commissioner for the People's Republic of Bangladesh. I'm talking about High Commissioner Masudu Rahman. Your Excellency, you're welcome, sir. Then we have the Director General of the National Institute So I received an update on the security situation, and just to reassure you that everywhere is calm. So as I was saying, I want to invite the Director General of the National Institute for Pharmaceutical Research and Development, NIPRID. I'm talking about our amiable Dr. Obi Adigwe. Dr. Obi Adigwe. Sir, you're welcome.
true. Don't worry.
All right, so you're welcome to Lagos, the Center of Excellence. So I want to invite our chief host, since you're here in Lagos, to come over to the high table so that he can welcome you properly to Lagos. I'm talking about the Honorable Commissioner for Health, Lagos State. Please join me to welcome Professor Emmanuel Akinola Abayomi. A round of applause for him, please, as he takes his majestic steps to the high table. Can we unveil the seats reserved for the Honorable Commissioner? Honorable Commissioner, sir. You're welcome, sir. There's a long list of recognitions here, and I'm going to take all of them to be able to earn my pay. So I will do that as the program progresses. But maybe I should just begin by securing my license to practice by recognizing the presence of the Pharmacist PCN registrar is here present. I'm talking about Pharmacist Ibrahim Ahmed. Pharmacist Ibrahim Ahmed, sir, you're welcome. Yes, thank you very much. I just secured my license. So other recognitions would go on as we proceed in the program. I would like to invite the MD of May and Baker Nigerian PSC, who is the chairman of this Nigeria Pharma Manufacturers Expo. Please join me to welcome Pharmacist Patrick Aja. Pharmacist Patrick, please.
Thank you so much. Welcome to Lagos. Welcome to Lagos. Thank you. The chief host of this occasion, the Honorable Commissioner for Health, Lagos State, the host himself, the chairman of PMG-MAN, the representatives of the honorable ministers here present, the DGs of very important ministries here present. Want to thank you, very special guests who are here. Please permit me to stand on a protocol that will be set by my chairman when he comes. But I'd like to say, on behalf of PMG-MAN and our associates, that many of you made sacrifices to be here. And I want to appreciate all our guests from outside of the country, high commissioners here present, India, Bangladesh, and many other ministries here represented, PCN, our own president. We want to thank all of you, SARS, for honoring this very important occasion. This is the Pharma Manufacturers Expo. As you know, every 2 years, we try to hold this expo to show the capacity that we have in the country and the collaborations that we have. But because of COVID, the last one, the 5th edition, was in 2019, and we couldn't do it because of COVID. But we said so that we don't let this thing linger for a long time because of the benefits, we had to make sure that under a very short notice, we'll set this up. And that is why I said many of you made sacrifices to be here. So I just want to welcome our dignitaries. I want to welcome all our special guests. Please, can we put our hands together for all our special guests who made sacrifices to be here? I want to thank you. I want to thank the committee. On a very short notice, they got together and they made sure that this happens. I want to thank Mr. Paresh. Mr. Paresh, wherever you are. Mr. Frank, where are you? If you have an occasion and you do not have time and you need to put together a world-class event, I have two words for you, P and F, Paresh and Frank. At a very short notice, they got people from all over the world. I like to tell you, we have over 80 companies from outside of Nigeria represented here. I am sure when we are done with this opening ceremony, we are going to go and see the exhibition stands. So on behalf of my chairman and PMG-MAN and the committee, I'd like to welcome you, and I say welcome to Lagos, welcome to the Pharma Manufacturers Expo. Please make sure you enjoy this occasion and take a tour with us to the stand and see the opportunities that Nigeria is making happen, and it's going to get better as we go on. So once again, thank you very much and welcome to this very important occasion.
Yes, this exhibition indeed is world class. The last time I saw something like this was the exhibition in Dubai. Who is doing the pharma industry is there at the exhibition section. So we'd like to invite the chairman of PMG-MAN to make his chairman's, where is he? Ah, okay, good. You were seated there before. All right, so to make the chairman's remark. Please let me to welcome Dr. Fidelis Ayobi.
Thank you. Your Excellencies, DGs, directors of ministries, and representing the honorable ministers of health, of investment industry, chairmen of councils, the distinguished excellencies. There was also the Indian. All right. Can you please lead him to my seat? Please take him to my seat. It will be inappropriate to have one ambassador and then, omit to put the other ambassador on the high table. Your Excellencies, High Commissioners of, Bangladesh and the Consul General of the Indian High Commission General of the Indian High Commission in Nigeria. Distinguished invitees, the press, members of the press, distinguished ladies and gentlemen, my dear brother, Shehu, Baba Shehu, and my dear brother, it is a very happy occasion again that we're coming together for this exhibition. This exhibition must be the 6th or the 7th in the series that PMG-MAN has held, through these many years. Like Patrick Ikeja said, we couldn't hold the one of 2019. Well, we then said to ourselves, if we again fail to hold it this year, we are slowly losing ground. And that was why we hurriedly put together what you are going to witness here today. But in spite of the short notice, the organizers have put together a world-class event. You would also notice that there used to be an external marquee where equipment manufacturers, used to exhibit their equipment. That is not there today. That is more because it was a short notice, so the equipment manufacturers couldn't ship their new equipment, to Lagos. It is also regrettable to announce that one of our big partners also is not here this year, the Chinese. They couldn't make it because of the protocol, the COVID protocols in their country. They will be required to quarantine, I'm told, for a total of about 12 days or so. Some 3 days in the country of transit and some 7 days somewhere in Beijing and so on and so forth. Regrettably, they are not here this year. But be rest assured that we will get back on steam, 2 years from today. I want to truly appreciate the Honorable Commissioner for Health, who agreed also at a very short notice to be our chief host. So I'm going to be leaving this event in his hands as our chief host, but suffice it to say that we're all very grateful to all of you that are here. We're thankful that you found time to come, and we do hope that at the end of this show, you would also make up your mind to be an investor in the pharmaceutical industry. Now, let me drop a note of caution. All of you policymakers are seated on this table, and some of you are on this side of the table. The honest truth is, and we can all see what is going on in other parts of the world, so it's not just Nigeria. But the case of Nigeria is one that is waiting to happen if policymakers don't do something about so many things. A lot of industries in Nigeria would need to be protected, chief of which is the pharmaceutical industry, the pharmaceutical manufacturing industry. If you do not protect this industry, we stand a chance of exposing our people to the vagaries of the international politics when there are pandemics, when there are epidemics, or there are shortages of even APIs around the world. No country would export products simply to make money when they have a need for those products in their own country amongst their people. And so it is incumbent on our policymakers to protect most of our industries that are today at risk. Like I said, chief of which is the pharmaceutical industry. Why is the pharmaceutical industry at the top of the line? It is essentially because, like we say, health is wealth. People that are sick and can't find a cure or a palliative, for their illness, simply cannot create wealth, simply cannot belong to a society. I hear about tariffs wanting to be changed, at ECOWAS level. I hear about all manners of things, right? And I want to say it loud and clear. In the face of no dollar, in other words, Forex, to import APIs, machinery, excipients, and so on and so forth, coupled with the challenge of accessing cheap funds for working capital and for running our factories, coupled with high tariffs on some of our imports that we do, it will be most unfortunate if we again have reversal of policies by ECOWAS simply because not WHO, WTO is leaning on people to open up their countries. There is no country that can survive in the world without a modicum of protection. This industry needs to be protected through policy, through regulation, and every other card that we can play to ensure that this industry that is still yet at its infancy grows. There are billions of dollars of investment at risk here, and there are over 10 million direct and indirect employees working in and for the manufacturing sector of the pharmaceutical industry. These need to be protected. The West is the West, and you cannot want to compare what the West has become. They talk about free trade, open borders, and so on and so forth. We are not at that level. It is great to talk about AFCTA, but the question we should all ask ourselves, including those of us in the pharmaceutical industry, is are we truly ready as a country, right, to participate in that protocol, AFCTA? If the borders are open today, Nigeria is just going to be inundated with all manners of imports, right? And so we need protection. So I welcome you once again to this event. Thank you very much for coming. Enjoy yourselves as much as you can. And to our keynote address speaker, thank you very much, sir. I'm sure this morning we are going to hear, a lot of things from you that will help us improve, our environment, our industry, and what have you. Let me also say that as an industry, we are a supporter of WHO. The work that you folks did straight from Geneva on COVID was unbelievable. It was unbelievable. You saved the world. The commissioner, right, Lagos State was also one of those that saved a lot of us. Some of my dear friends would have died of COVID. Thank God for IDH, Yaba, who saved those people, even when there was no real known protocol for treatment, right? Lagos took the lead. Thank you very much, and God bless you.
Thank you very much, Chairman, sir. For those who were in doubt, that wasn't the keynote address. I see people already taking notes. That was the welcome address. And we're saying once again, welcome to Lagos. But it's not my duty to welcome you to Lagos because we have the chief host here who will do that. Please join me to welcome, as he makes this address, the Honorable Commissioner for Health, Professor Emmanuel Abayomi. Commissioner, please.
Good morning, everybody, and for those of you that are visitors to Nigeria, welcome to Nigeria, first of all. And those of you that are visitors to Lagos, whether you're from abroad or you're from within the country, welcome to the Center of Excellence, the State of Aquatic Splendor. And I bring you greetings and felicitations from the State Executive and no other person than His Excellency, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, and the entire State Executive Council. Thank you for inviting me, Chairman, to this occasion. I didn't actually know about this meeting, and when it was brought to my attention, it was me that requested that I should make the time to come and spend with you. I won't have much time today, so I apologize in advance because we sneaked this into the manifest. And so, as much as I would have liked to spend a significant time with you, please allow me to exit soon in the program of events so that I can get to other pre-scheduled activities. But let me first start by welcoming the Honorable Minister for Health, Dr. Hanire, who is represented here by pharmacist Olubumi Aribe. Thank you very much for attending. The Senior Specialist Assistant to the President on Public Sector and the Secretary Action Committee on Africa, Mr. Francis Anatogu. Thank you very much. To my friend and colleague, Professor Mojisola Adeyeye, the DG of NAFDAC. Thank you very much. Nice to see you as always. The chairman of the NPME, pharmacist Patrick Aja. Thank you. Chairman of PMG-MAN, we've just heard from you, Dr. Fedilis Ayebaye. Thank you very much for that welcoming address and for outlining some of the issues we need to pay attention to. And to Dr. Walter Kazadi Mulombo, my WHO colleague, my fellow combatant on the ground. And yes, all credit to WHO and the federal government and the state subnationals for confronting COVID as a biological threat to our welfare, livelihood, peace, and security. Everybody else that's invited here, thank you. And to gentlemen of the press, indeed, a pleasure to be here. I just managed to sneak into the exhibition hall briefly, and I was pleasantly astounded by the size of the exhibition that you have this year. And just looking at some of the exhibition stands, the dexterity and the diversity of pharmaceutical manufacturing products, strategies, and techniques. But I'm particularly grateful for the title of your welcome address, which was Advancing the Frontiers of Medicine Security. And this indeed is a very important subject matter to us as government for a variety of reasons, which I will allude to shortly. But the Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria, PMG-MAN. I'm also a little bit surprised as to how old you are as an association. 40 years is a long time, and that, you know, your elders in the fraternity saw it fit to form this association so long ago when manufacturing was not even a subject matter of consideration in this country. I think demonstrates the vision and the foresight of this sector of the healthcare and economic manufacturers fraternity. So 40 years, I congratulate you. You've grown from 20 foundation members to 120 manufacturing companies. I think that certainly deserves a round of applause and accolades to yourselves. And clearly, you've been able to achieve accreditation and good manufacturing practices, which is key to ensuring standards of your manufacturing processes. I was asking there was something in your speech that I didn't know the acronym for, and it's the African Continental Free Trade Agreement. I think that's certainly the way to go, because if there's one lesson we learned from COVID was that you're on your own. And I want to repeat that in case you didn't hear me. I said, COVID taught us that you are on your own. When you're faced with a biological shock of this magnitude, everybody is scrambling to look after themselves, and nobody has any spare capacity for you. And thank God for the WHO and other high-level donor agencies that deployed assistance, both technical and expertise, to the States for a period of 2 years when the whole world didn't actually know what was going on. And so for us as Africa, we need to understand that we are on our own. And it is important that we establish these economic agreements and establish movement of expertise, movement of product, movement of strategy easily and freely within countries of Africa and within the countries, obviously, to the states and subnationals. And, you know, if you just switch on your television any day, you will find that there are two things that are bothering the world. The first one is climate change, and the second is the fallout of COVID and the global insecurities that have emanated that are creating economic stability worldwide, instability worldwide. And so I also appreciate your emphasizing the strong nexus between health security and national security. And we in Lagos, during COVID, had to be very mindful of the relationship between managing a public health crisis and ensuring that we don't interfere too much with the economic activities of the state and ensuring that our citizens can continue to generate their personal livelihood. For if you don't pay attention to that and you come in with a heavy hand on public health control, you might be interfering with the economic forces within the state and plunge the state into economic crisis, which leads to security crisis. And we experienced that during COVID in Lagos, and the incident commander and his war room cabinet were very, very mindful, and it was certainly an eye-opener as to the deep relationship between health security, economic security, and national security, and they work hand in hand. For it would be unwise of you to have a heavy hand trying to control a public health crisis and plunge the state into an economic crisis, whereby the casualties of economic crisis are higher than the casualties of a public health crisis. So the government has a very delicate balancing act. And I'm sure that you agree that Lagos State was able to achieve that delicate balance, whereby we were able to ensure continuous local economic activity and also encourage our international partners that Lagos indeed was a safe place to come to, even during the peak of our 5 waves of COVID. And this ensured that the foreign direct investments into Lagos State, the economic ecosystem was shielded and protected from the forces that COVID tried to unleash on us to disrupt our sense of economic livelihood and peace. And those are some of the attributes that Lagos State has and is proud of, which is what makes it perhaps the 4th or 5th largest economies in Africa. And Lagos sometimes behaves like a small country, although, of course, it's still a subnational. But we're proud of the fact that we can anticipate things and that we can be mindful of what needs to happen for us to ensure that we have a shield that builds the resilience of Lagos to any forms of shock, whether they are biological, whether they are crises, whether they're environmental. Shocks are shocks, and they come to disrupt life and to create chaos. And it is the responsibility of government and its partners and everybody, really, to make sure that we are not subject to these fluxes. We often talk about indigenous capacity. And throughout COVID, you will recall everybody was a little bit upset that Africa does not have the capabilities to manufacture or the technology to manufacture pharmaceutical vaccines. And, you know, those of you that are here and, you know, those of you that are familiar with biotechnology and good manufacturing practices understand that it's not easy to leapfrog in this manner. And it's contingent on an ecosystem that is supportive of these manufacturing opportunities and innovation. And what we've done in Lagos is, having recognized our Achilles heel or our Achilles tendon in this regard, is to drive policies and guidelines that make sure that we don't fall into the same area of vulnerability as we found ourselves during COVID. Having said that, I keep saying that it's not easy to manufacture vaccines. I mean, we are within a pharmaceutical environment at the moment, and vaccines come under your jurisdiction. And you all will agree with me that vaccine manufacture is not a plug-and-play matter. It is a matter of creating the environment, the economic incentives, and the biotechnological and pharmaceutical knowledge base and ecosystem to encourage these kinds of developments. I'm very encouraged to see the large numbers of our friends and colleagues from the Indian subcontinent at this meeting, because the fact that they're here and the fact that we recognize that they are the #1 manufacturing continent in the world, alongside with China and other members of the Asian subcontinent. The fact that they are here in such large numbers demonstrates that they are beginning to take Nigeria very seriously in this regard. And I think even I myself am very encouraged by the strategy by most pharmaceutical industries here in Nigeria to continue to develop and push towards local manufacturing and composition of medical pharmaceutical agents. And I encourage you, and I applaud you for that, to set those targets for the industry and to continue to collaborate with our partners from the Asian subcontinent. There's no need for us to reinvent the wheel. All that we need to do is to collaborate, to partner, and to encourage the introduction of these opportunities for indigenization of the sector. We have created in Lagos something called LASMIZO, and that is an acronym that stands for Lagos State's Medical, Industrial, and Innovation Zone. It is still on the drawing board, but it has reached a fairly advanced stage of development as far as we've already identified space for this initiative, and Mr. Governor is very keen that we create the environment, a free trade zone for movement and manufacture of drugs, but also that we're driving a local indigenous agenda for research and development, followed by setting up innovation pipelines that lead to the local development of drugs and medical therapeutics. I also like within the framework of your welcoming address, the fact that you alluded to your strategy as one in military terms, and you ascribed and alluded to it as your strategy should be adopted as a wartime footing. I think those are very important words, and I think that once you see an expression like that, it gives you the clear understanding that your association is not joking and that you mean what you say and you're going to do what you say you've set out in your agenda. And so I also believe that it is an emergency. I also believe that it is important that we develop indigenous capabilities and that we stick to international benchmarks of good manufacturing practices to ensure that we are not looked at or looked down upon as a substandard environment for manufacture, research, development, and innovation. One of the areas that is of particular interest to us is the traditional medicines and the traditional complementary and alternative medicine fraternity is a very large fraternity in Lagos and Nigeria as a collective. And, you know, we may feel that as orthodox medicine practitioners that our drugs and our vaccines are the first port of call. But you would be seriously mistaken if you had that impression, because most Lagosians and most Nigerians and essentially most Africans, and in fact, even on the Asian subcontinent, you know that our people will patronize traditional medicine and alternative medicine providers, sometimes and often before they even come to us. So it's important that we regulate this sector also, and that we are aware, after all, they are also dispensing medicines, if you like, in the form of herbal concoctions and remedies. And it's important, and I'm glad that my sister, Professor Adeye, is here. This is a big problem for us to ensure that, you know, our citizens are not exposed to drugs or herbal products or concoctions that have not been tried, tested, and put through evidence-based medicine protocols. We've established a traditional medicine board, and that's been active for the last 3 years. And they've been very, very astute to their responsibilities, trying to make sure that anybody who is providing a health service in Lagos State, whether you are operating as an orthodox or you're operating as an alternative medicine practitioner, that you're subject to accreditation and you're subject to regulation. And we've been trying to get rid of street hawkers that are selling drugs that are not at the standard that we are prescribing for our citizens, working very closely with the pharmaceutical stakeholders in this strategy. Let me close by just reminding you what the functions and responsibilities of government are. The first thing that government does is to, with its stakeholders and in consultation, is to define policy and put in place regulatory mechanisms that can enforce laws, policies, and guidelines. So that's a very important function of government. And the reason we're here today is to make sure that manufacture or importation of medicines, as your title stipulates, is one that doesn't compromise the security of the state. And so we're looking for standards, we're looking for good manufacturing practices, we're looking for quality control and assurance that any drugs that are available in Lagos for our citizens are subject to a regulatory framework, either by virtue of it being imported or it being manufactured in the state or in the country. The second thing that government does, apart from the third thing, of course, defining policy and then enforcing the policy, that's the second thing. The third thing we do is government recognizes the role and responsibility and contribution of the private sector. And so government needs to create the enabling environment for the private sector to flourish. So all of you here, most of you here are from the private sector. And it's not government's job to set up all these manufacturing plants. No, it's your job. It's our job to make sure that you find a fertile ground, that you find that the rules, regulations, and policies are not restrictive, and that we are creating the environment for you and your economic initiative through this manufacturing ideas finds fertile ground to flourish and to prosper. That is a win-win situation for everybody. And that certainly is an emphasis from us. And then let me just stop at the next function. The next function of government, and very importantly, is to be a public protector. So having enabled the private sector, having set guidelines and policies in place, it is very important that as government, we are constantly at the table ensuring that with our partners and with our stakeholders, that we're not allowing exploitation, we're not permitting abnormal use or configuration of any of your strategies that would create a scenario that threatens the security of citizens of this state. And so while we want to create a very harmonious economic environment, we also have to maintain our role and our responsibility as an overarching public protector. So on that note, I would like to encourage all of you. I hope that this meeting provides the opportunity for networking between visitors and local companies. I hope that those of you that are visiting Lagos and Nigeria have a good experience with us. I hope that you will come and share with us the benefits of your knowledge and expertise, and that if you take any message away, that the government here is very proactive in ensuring that we can work with you and that we are creating that milieu that satisfies you as a partner in this venture that we have to achieve higher levels of indigenous manufacture. We also know that it's important that there is capacity transfer, not just in the manufacturing sector, but also in the research and development sector, because it's research and development and innovation pipelines that really drive this economic hub of drug security. And please, while you're forming your relationships with your counterparts in this state, the government is very interested in parallel activities around innovation, research, and development, and of course, importantly, around the laws that govern intellectual property, copyrights, and patenting. These are all very important attributes and drivers of economic growth, and it's something that we would encourage you to think about as you form your relationships with your counterparts on ground. Please feel free to send any questions or suggestions to my desk or my office through whatever means you find possible. My name and email contacts and my telephone numbers are public knowledge. You can send me messages, you can write a letter to my office, or you can go through the association to reach me, or any of the associations here present, to send to me ideas, suggestions, and opportunities. So thank you very much for this opportunity. I'm glad to be here. I'll spend a few more minutes with you before I depart. And I look forward to the proceedings of this conference and this summit as input into policy formation and laws and regulations. Thank you very much.
Thank you very much. You've been listening to the chief host of this occasion, the Honorable Minister for Health, Lagos State, Professor Abayomi. And a round of applause for him, please. Now it's time to get the message from the presidency. We have here with us the senior special assistant to the president on public health, public sector. Yes, public sector. And most importantly, he is the secretary of the Action Committee on African Continental Free Trade Area. Actually, you might be looking at the high table, but not to look there because the high table was brought here to its place. Please join me to welcome Mr. Francis Atogu. A round of applause for him, please, as he makes his remark.
Good morning, Honorable Commissioner, representatives of the Honorable Ministers of Industry, Trade and Investment, and Minister of Health. DG NAFDAC, good morning. Your Excellencies, distinguished ladies and gentlemen, the President Pharma-MAN Association. It's an honor to be with you this morning to talk about the Africa Continental Free Trade Area. I think the topic of Africa Continental Free Trade Area is important. It's very, very important. If you look at the theme, there are various key words there. It says medicine security. It talked about expanding local pharma manufacturing, but also there's partnerships. And Africa, the professor, you put it quite correctly, you are on your own. We are on our own. The Africa Continental Free Trade Area recognizes that we are on our own. It recognized it way back in the 60s when we started the independence journey. That was when the Africa Continental Free Trade Area was actually conceived. Not as AFCFTA, but the recognition that we need economic power to be able to exercise our political power at the world stage. And COVID told us exactly why we must rely on ourselves. Prof also talked about the role of government in terms of policies and regulatory framework, but also protecting people. So you can't, when you now start thinking about medicine security, it's not just for profit. It's about lives. But you cannot get all of that if there is no value proposition for the private sector. And these are all enshrined in the Africa Free Trade Agreement. First of all, in a nutshell, it's about trading between African countries as if you're trading between Kano and Lagos. What does that mean in practice? It means trading without paying duties. It means trading under the same set of standards. It means cooperation among regulatory entities. It means resolving the issues of currency. And with Africa Continental Free Trade Area, a Pan-African payment system, payment and settlement system is already being trialed. So it means movement of capital. And what we see today is that focus has been on FDI, but with Africa Continental Free Trade Area, We are talking about FDI, but now about Nigerian capital moving to other African countries as well. So even our regulation and the way we protect, it's not just about protecting our businesses home, but we need to protect our businesses as they move into African countries. And it's a slight change in how you approach that. Intellectual property rights means that not only do we recognize these rights here in Nigeria, but we must make sure that our people get the benefit of those rights in other African countries. And you don't need to look beyond Nollywood to understand why that is necessary. Because a lot of what happens, a lot of what we create today in Nollywood are pirated and we don't get value for it. And all these are part of the protocols under the Africa Continental Free Trade Area. And when we talk about tariff, and by the way, for a lot of medicines across Africa, the tariffs are low because they are medicines. You can have areas to play in terms of the raw materials and so on, but thinking about tariff is key. But you also need to understand that there is, beyond tariff, there is rules of origin. A key element of what Africa Continental Free Trade Area is trying to achieve is movement of made in Nigeria, made in Africa products. So, with that in mind, there are rules of origin to guide for each product, be it pharmaceutical, agricultural, and so on, must meet a minimum standard of made in Africa. I didn't say made in Nigeria, because when you can get that product from Africa, it counts as part of your benefit when you're calculating the made in Africa requirements. What this also then means is that we now need to look to other African countries to see where can we complement each other. It's about partnerships. It's about ecosystem. But it's also about the value system, and I'm happy that Prof is here from NISA. So it's about partnerships in primary research, partnerships in biotech, partnerships in production, partnerships in distribution. Much earlier, I don't know if DG will remember, about a year or two ago when we were talking about AFCFTA, she talks about the need to improve the production of APIs in Nigeria. So making sure that we develop that local capacity and the key things that we need to be able to participate in Africa, but also be able to maintain that medicine security or health security is important. I have news for you. As today, Africa's import of medicaments exceed over $10 billion per annum. That is a lot. So we may not have the vaccine capability, but we have capabilities in a number of areas. And we may be challenged in a number of areas. But in my 5 years working on this Africa Continental Free Trade Area, there are a couple of things that have stood out for me. One is that the average Nigerian businessman, manufacturing, distributor, is content with the local environment. What I hear is that I have not met my orders to the local environment to start thinking about Africa or export with all the problems that come with it. What that means then is that we are not even seeing the opportunities. So someone from NABG, Agricultural Group, came back from an agricultural summit in Namibia, and he called me, and he said that he was there, and he found out that a product per carton in Nigeria will cost you about $2, but in Democratic Republic of Congo, it's about $15. So it is important, and that's one of the messages I'll leave you with, for our manufacturers, yes, the problems of finance, problems of information, all of these things are there. Problems of infrastructure, all of these things are there. But also there are the opportunities across Africa that we are not looking at, we are not exploring. And we need to start looking for those. In this job, one of the key things one of the questions that I kept being asked is, what are we going to sell to Africa? What are we manufacturing that we're going to be a dumping ground? This is this and that is that. And of course, we started looking. And information is there. Be it the National Bureau of Statistics, International Trade Center, or World Bank. You can check these things out yourself. And we find out that across agricultural products, across manufactured products, oil and gas, we have products that Africa needs a lot of. And that we took a threshold. Show me those products that we already export $10 million of per annum. And we have a list of products. What we also found is that even in some areas, especially in the agricultural produce, if you check, for instance, cassava, palm oil, our export is near zero. Why is that? Because our local consumption is a lot. So, but that doesn't change the fact that Africa imports billions of dollars of these products on an annual basis. And that is the spirit of AFCFTA, to make sure that we provide that environment for African producers to see that opportunity and try to close that gap. I will not say it's going to be easy. A lot of these things that I've talked about is work in progress. As some of you may know, 7 countries have started piloting trade under AFCFTA. The journey is long. And just look at EU to see how long it will take for us to get to where we expect to be. They've been at their own journey for over 70 years. Other countries over decades. So what we are looking at is a major project. But there are areas of strength that we must focus on. There are over 6,000 tariff lines, and you can't focus on 6,000 items. There are areas of strength. Prof talked about alternative medicine. The alternative medicine from China itself, I don't have the figure, but please check it out. It is in billions, in tens of billions of dollars per annum. Can anybody cook jollof rice more than Nigeria and Ghana? Can anybody cook jollof rice? If you go into, so there are areas where we have that. If you go to, what we are wearing, if you go anywhere in Africa, people ask you, can I have some of this? And a lot is already been happening at SME level. But for us to take advantage of AFCFTA, we must build scale. So scale, productivity, packaging, and all the other export requirements are critical. The standards are critical. The logistics. But all these things are already happening. And my charge to you, distinguished ladies and gentlemen, is to find yourself in AFCFTA. By the way, as big as AFCFTA is, as big as Africa is, Africa's contribution to global trade is just about 3%. So the bigger market is out there beyond Africa. But with AFCFTA, you have the platform So, distinguished ladies and gentlemen, at the National Action Committee, we've identified 8 pillars that we are pursuing this. So one is growing our production capacity. So producing what we are going to sell in Africa. 2 is that trade facilitation to make sure that we are competitive. Access to finance. There's a lot being done there. There's a lot that needs to be done. Access to information. There's a lot being done at AFC, at Africa level. There's a lot being done at home. Infrastructure. Trade factors. So recognizing making it easy for people to move across Africa. But also coordination, institutional coordination. And this is an area where the private sector and the public sector has work to do, to coordinate, to understand these policies that we put in place, are they working? Where do we need to make changes? He's already here, so I know he wants to take the microphone. So I would say thank you very much, and I wish you all a great event. Thank you.
That was very brilliant. Thank you very much, SSA, to the president. So we'd like to document this event by having a group photograph, and we'll invite the chief host of this occasion, the Honorable Commissioner for Health, Lagos State, Professor Abayomi, to lead the other members of the high table to come to this side of the hall to take a group photograph so that the chief host can attend to other state matters. Photographer, please. Okay. All right. Honorable Commissioner, please. Yes. SSA to President, please. You can tell Baba that you are here, so. Okay. All right. Our DJ, of course, nicely. All right. Please, arrange. So we need to make it 2 lines. So some might just climb behind. Yes. It's safe. It's safe. You can climb behind. Okay, you have been ordered to remain here. So, yes. Maybe if you just climb behind. It's all the same level, or they're all first class, sir. If you just climb. Okay, you climb. Okay, all right. All right. Okay. So how is it looking? All right. PCN registrar, where is he? Okay, yes, okay. All right, so done. One more. What? Okay, all right. So thank you. You might go to your seat, but please, we just need 5 persons in front. The 5? Yes, just for the media shot, please. Yeah. Please, yes, we need. Is this ideal? Okay. Journalists, are we okay with the media shot? Okay, thank you very much. All right. Yes. So the chief host will take his leave now, and we shall inform you of the keynote address. Okay, all right. Okay, all right. Thank you. Thank you. All right, so I will usher in the keynote address speaker. After the keynote, we shall be listening to the policy statement by officials of the government. So the different government agencies here present, you would have your turn to speak. You will come after we've listened to the keynote address. Our keynote address speaker is the World Health Organization country representative to Nigeria, Dr. Walter Molumbo. Can you stand? Yes, please. Let me tell you a bit about him. I present to you a long-standing and well-respected WHO international expert who is a public health epidemiologist from the Democratic Republic of Congo. Dr. Walter Molumbo has over 30 years of progressive experience in clinical practice, management of healthcare, primary healthcare to be precise, health policy dialogue, governance and coordination, as well as implementation. Before you is a man who has held senior international positions in both English and French-speaking countries. As regards education, Dr. Molumbo holds a master's degree in public health from the prestigious London School of Tropical Medicine and Hygiene. He is a trailblazer with expertise in the management of primary health care. Primary health care, as you are all well aware, in the Nigerian context, is the bedrock of the National Health Policy and National Strategic Health Development Plan in support of the universal health coverage and the health-related sustainable development goals. Please join me to welcome the WHO country representative to Nigeria, Dr. Walter Molumbo. He'll be doing for us the keynote address.
Thank you, MC. As I was, Your Excellencies, dignitaries, DG, directors, High Commissioners, please allow me to, and the host who has left us, please allow me to stand on existing protocol and deliver my keynote address to this occasion of the 6th Expo. As I was listening to the hosts and the previous speakers, I was asking myself, what more should I say? Because they have said it all. Africa, indeed, we are on our own. No need to repeat that. Let me just give you, to start with, an anecdote. It's not actually an anecdote, it actually happened. I have my own family based in a developed country. And one day, we took a flight. I was coming back to Africa, where I'm based for my work with WHO. And then shortly after the takeoff, we had some announcement. We need emergency landing. And that was a big aircraft with almost 300 passengers on board. We have to do an emergency landing. So the pilot started pumping out the fuel for us to land safely. So we eventually landed. But what I learned is that one of the passengers felt unwell, and it was assessed as a life-threatening event for one passenger out of 300. The pilot took the decision to land in emergency to allow that passenger to access the care. After he was disembarked, the pilot put full gas to take off. 2 seconds later, he had to stop the plane, the aircraft. Why? Because the air controller didn't see that there was another plane landing. So we saw that. We have to leave the runway. I was on that aircraft. So now listen, why I'm saying this. Not long ago, I was coming from a developed country, coming back to Nigeria. When you approach the runway, there was an announcement, please don't land now because there is something happening on the runway. That was unexpected. So the pilot went up and we started going around before landing. But the pilot said, pronounced a comment, "Welcome to Africa." And everybody laughed. I was offended. Because where people should have been, embarrassed is where we missed a clash on the runway. But this was just a prevention. So security is our own business. And medicine security is really part of global health security agenda. You remember in 2007 was launched or endorsed the International Health Regulation to regulate prevention, response to public health risk and pandemic. In 2014 was launched the Global Health Security Agenda in the US in collaboration with many other developed nations. 2014. In 2019, the evaluation of Global Health Security Agenda showed that no country was ready to respond to a pandemic. It was in October 2019. In January, we had the COVID-19 pandemic. And we saw that truly we were on our own. Health is a continuum from promotion before even the disease strike to prevention. And when we have health issues, to restoration of health across life course. If we can't restore, we have palliative care to maintain us in life, living as long as possible. And you realize that at each of these states, we can't do it without medicine security. So medicine security is truly ensuring that everybody has access to quality, affordable, acceptable, according to culture, high quality medicine, not counterfeit medicine, is ensuring that. To ensure that, the Commissioner for Health said the government has its role, but also the private sector has a role to play. A few weeks ago, I was invited at Chatham House in London to discuss the road toward universal health coverage in Nigeria, leveraging on partnership and opportunities that are related to partnership. I was privileged to attend that session with our host and his representative. We were another 2 executive governors, some DGs, and many other dignitaries to discuss what else can we do to accelerate the pace toward universal health coverage in Nigeria. bearing in mind that because of the COVID-19 pandemic, all the sustainable development goals are lagging behind. And a critical discussion was the role of private sector in a country like Nigeria, where 70% of the population get access through private healthcare and the traditional medicine. How can we ensure that everybody has the medicine, the healthcare they need in this context? And I'm glad that our host emphasized the need for collaboration and partnership. And he has highlighted very well the role of government, be it regulation, be it ensuring enabling environment, but also protecting the consumer from fake and counterfeit products. In each of these areas, the government needs strengthening. We've been working with the Minister of Health and LAFDAC to ensure that they get the appropriate maturity level. I'm not the one to announce it, but I know that Nigeria is on its course to be announced. It's just a matter of formalities to have reached maturity level 3. It's one of the few. Okay, I'm happy that we are confirming it. Okay. So now we have to go for maturity level 4. It's one of the very few countries in Africa. Now, I'm sure Nigeria is providing also enabling environment, as described by our host. And Lagos has always been, as a matter of fact, at forefront. It's truly a center of excellence. This is the place where the Ebola outbreak was killed when it was ravaging in the rest of West Africa because of good systems in place. So it's really an area, a location where we look forward to learn on what it is when it comes to providing enabling environment and protecting the consumers. So let me challenge you. Today is your day, the private sector. We've been watching all these global health initiatives, Global Fund to fight HIV, AIDS, TB, and malaria, Gavi Alliance for vaccination, and many others. When it comes to procurement of health products, where are they being sourced? You've been told for ages you need to achieve, you need to get WHO pre-qualifications. How long are you going to wait to get that? Are you waiting for the next pandemic to start crying again over spillover eggs? Because they can't source. So how long are you going to wait for us to get that level? It's a process. How long? Even when some of our countries achieve that level and start manufacturing vaccine, we are not buying vaccine from those countries. We continue to source them outside. And we have the figure of how much we spend in terms of importation of medicine. So it has been a journey, and COVID-19 pandemic has shown us the vaccine injustice, but most importantly, the cost of being unprepared to deal with major public health events. So we have many challenges. We've been hearing about them very long time ago. There have been agreement, and here we are discussing on how to leverage on African free trade, continental free trade agreement to boost our manufacturing sector in terms of producing vaccines. But these agreements have been there since 2005, 2007. We've been hearing it. We've been investing in it. So when are we finally going to take action to ensure that Africa starts consuming products produced on the African continent? If we look at the average trend, Africa consume more or less a little bit less than 20% of what is produced in Africa. The rest, it's imported. But when we look at other continents, they consume between 50, 70% of what they are locally producing or manufacturing. How long are we going to maintain that situation? So the government has its role, but the private sector also have a role to play, particularly when it comes to producing countermeasures to address major epidemic and pandemic. It's a very, very critical sector. And there are many components of this medicine safety. You look at regulation, you look at production, capability, we look at the equipment, you know, the prescription, the behavior of the dispensation, the patient. That there are several areas we need to act upon. But as I said before, after hearing all these introductory remarks, I was wondering what else I should say, because none of these are new. We've heard them before. Is it not a time for a paradigm shift? And how should it look like? I believe on conference like this, we should really deep dive and make sure we come up with actionable solutions beyond political declaration. Our other states have done it all. They've signed an agreement. We have a meeting at the UN General Assembly, the World Health Assembly. We have a lot of meetings. I think now it's time to change gear. That's the price to pay. WHO already in 2016 was, for instance, alerting the world on shortage of essential medicine. Early in the pandemic, COVID-19 pandemic, there were some studies that demonstrated that dexamethasone was an important adjuvant to the treatment for those who have severe disease. But dexamethasone was already in short supply. When WHO approved the first list of COVID-19 vaccine, and the emergency use list, there was vaccine hoarding. The whole of Africa suffered. Now, the COVID-19 vaccination coverage is very high in the developed countries. The reason why, they've reopened the economy because the vaccination coverage is high. What is African coverage today? It's not even 30% in average. So we are still at risk. Who waited for Africa to increase the coverage before the reopening the economy? Nobody. But it took South Africa and Botswana to try to play transparency by saying, we've detected a new variant, the Omicron variant. What followed? The entire world shut all the flights from South Africa and from Botswana. And yet, Africa was protecting the world by giving first-hand information. Today, our vaccination coverage is not yet optimal. The entire economy is open. People are going to get vaccine because it's security for them to travel to those countries. Not really because they think they are being protected. And yet studies today have demonstrated that people who are fully vaccinated are 10 times less likely to develop severe disease, hospitalization, and death when they catch COVID. It's proven. What are we waiting for? Are we waiting for another variant to develop in Africa for the entire world to shut again the continent and stop our development? Or shall we take our own responsibility? When are we going to produce our own Africa-made vaccine? And for our political leaders, when are we going to decide to buy those vaccines? So that we don't just produce for it. So there are many possible debates and dimensions. But this, for me, is just an opportunity to raise awareness of your role as private sector manufacturer for medicinal product and vaccine to change the paradigm, to change gear, and really support Nigeria and other African countries on the continent to really accelerate the pace toward local manufacturing of medicine, vaccine, and other medicinal products. That's the price to pay. The rest will be theory. We heard since the Millennium Development Goal, health, a prerequisite, a precondition, health, a means, health, an outcome for developmental activities. But still today, health is still being considered as a luxury rather than a human right on its own right. I once challenged some senior officials in one country. We are talking about primary health care as a priority. How many policy documents outside health do mention, even mentioning primary health care? Not even allocating resources. And for optimal primary care revitalization, we need appropriate measures to guarantee access to affordable quality medicine. But if it's not mentioned in any document, whether finance or agriculture, environment, or other sector, how do we afford to make primary health care a priority and to make health an economic enabler rather than a consumption good? So there are all sorts of thinking that should really go through a paradigm shift. And from WHO perspective, we've been working closely with NAFDAC, with Food and Drugs, the Ministry of Health, and many other ministries and agencies to make sure that at least that message spread, passes across. We believe that if it cannot happen in Nigeria, it will not happen anywhere in Africa. Nigeria is really, has that potential to change the narrative on the African continent. And this can start with a real capability of local manufacturing of pharmaceutical products. We have started working with the government. We are opening up to the private sector. We really look forward to further this collaboration until that time it really becomes a reality. I would like to encourage you and urge you to quickly look at your equipment, your modus operandi, your operations, your investment to get WHO pre-qualification, because we want those resources we are mobilizing through Global Health Initiative to also benefit your growth. And I will end here by some wisdom from a wise woman who was in a village. She held a bird. Not the woman, sorry. A child held a bird in her hands, and with a hand at the back. Yes, time is up. I'm rounding up. So the child asked the wise woman, is the bird I'm holding in my hand alive or dead? The wise woman said, whether the bird is alive or dead, everything is in your hands. So everything today, tomorrow, to ensure medicine security is in your hand. Thank you so much for your attention. Thank you very much.
So move on to have the policy statements by officials of the government, and to assure everyone present that we have the section for the exhibition. I'll be moving there shortly to take a tour of the exhibition stands led by the members of on the high table. Before I start calling these government officials, I would like to recognize a few persons here present. We have the chairman of NAHIB. Chairman of NAHIB, can you wave? Well, a round of applause. Ken, we see you. We have the African Resource Center for Supply Chain Excellence, Azuka Okeke. I see you. All right. And the DG of National Health Insurance Authority, maybe represented by Olufemi Akingbade. Thank you. I see you. Welcome. And of course, a man you would have noticed here, His Highness, the Igwe of Ogidi Kingdom, His Royal Highness Igwe Oyibo, CEO Pharma and Ahmed Albu Pharma. All right. Of course, we have here, and because of lack of space, I would not read all the names here on this list, but I would like them to stand up for recognition. I mean the CEOs of all pharma manufacturing companies here present. CEOs, please. It's your turn to rise. Thank you, CEOs. You're recognized. Yes, I see. You are here, yeah. Thank you. And of course, the president of Nairofarm is also here. Nairofarm, president? Yes, oh, sir, I see you, sir. All right, and then the DG of NTA is here, represented by the Director of Medical Services, Dr. Damian Breyer. Dr. Damian Breyer? All right. And the India High Commissioner, represented by the Consul General, Kumar Ken. Kumar Ken. Oh, sir, you are recognized, sir. And very quickly, from NIPRIT, we have here the chairman of the board, our own Dr. John Alpha. Dr. John Alpha? Yes. You're welcome. Good to see you. And let me recognize my classmate. He was here, saw me a few minutes ago. He's the senior special assistant to the Ogun State Governor on Environment, Pharmacist Femi Akiwumi. Pharmacist Femi Akiwumi, you are welcome. Yes, things are blooming, and we have the CEO of Bloom, the founder of Bloom Healthcare, and he's there beaming with smiles. We all know him, we love him. Professor Chimeze Anokora is here present. You're welcome. Yeah. Representatives from Farm Access. Okay, before I hand the mic over to those who should be holding the mic at this time, thank you very much. We have here the MD and publisher of Pharma News, Pharmacist Ifeanyi Atweli. And of course, from the Nigerian Army Drug Manufacturing Company, we have Colonel Stella Ibe. I must recognize that she came very early, one of the first to arrive here. I think typical military style of punctuality. And we have the Executive Director of Nigerian Export Promotion Council, yes, the regional coordinator of this council is here of Southwest, here present Samuel Aye Bikpo. Aye Yikpo. Was there seated just now? Okay, sorry, I hope I've not murdered your name. Okay, I think we're done with this recognition after this last one here, which is the representative of Mr. Jane Bankole of UNEDO Regional Director, Mr. Alhaji Mustafa, Private Sector Development Expert. Sir, you're recognized. All right, so we move to here now the policy statements by officials of the government. So it's your turn. I'd like to begin with the DG of NAFDAC. Yeah. Professor Adeye. Where's the other mic? Okay.
Oh, thank you very much. I would like to recognize the Honorable Minister of Health, ably represented by Pharmacist Arabiana, and the Honorable Minister of Trade and Industry, represented by my brother. Sorry, I don't know your name. And I would like to recognize my fellow DGs. My president, Pharmacist Council, Pharmaceutical Society of Nigeria, and Professor Mora. Everybody is recognized. I want to stand on the existing protocol and get to the chase. It was 2019 that we had this event, and all of us could write maybe a chapter in a book as to our experience. We never envisaged pandemic, but NAFDAC was getting prepared for pandemic that we never knew it was going to come. About 5 weeks ago, I was in New Delhi for the Pharmexil meeting. That's the Pharmaceutical Manufacturers Group in India. And what was interesting to see was that that meeting was co-sponsored by our equivalent of our Ministry of Trade and Industry. It is extremely important to know that the Pharmaceutical Manufacturers Group is tied at the hip with the Ministry of Trade and Industry in terms of creating an enabling environment for the pharmaceutical industry in Nigeria. When we talk about universal health coverage, the enabling environment has to be there in order for the industry to thrive. What is the role of DG? What is the role of NAFDAC in this? The regulator or regulatory agency and the pharmaceutical industry. We are even better tied at the hip. Maybe we are tied by the chest also, like Siamese twins, with the industry. Because of all the functions that WHO benchmarked us for, all the functions have everything to do with the pharmaceutical industry. about 3 or 4, almost 4 years ago, we started what is called the 5+5 policy, where we want our local manufacturers to thrive. Because the picture that my brother, Dr. Mulombo, painted about the little child with the bird in his hand or her hand is very true of our situation in Nigeria. It is left for us to make do, to make sure that we are not dependent, totally dependent, almost like we are now, on other countries. And the 5+5 policy has been felt, it has been impactful in the industry, because essentially what it's all about is if you have been importing forever, in a way, and we have capacity in Nigeria to manufacture the same drug, during your last renewal of 5 years, you have to show us how to migrate to local manufacturing. We also have the ceiling, the NAFDAC ceiling. Until about 2 years or so ago, we had only 9 products in that, under that ceiling. Now we have about 34. These are products that are manufactured in Nigeria that we will not give license for importation. We will no longer give license for importation because we can manufacture this in Nigeria. It is very, I think I have to raise it because we couldn't do anything for 3 years. This time last year, we couldn't gather. Why are we gathering now? Because of the vaccine. What is the role of the regulator in terms of vaccine manufacturing? Without maturity level 3, no country can manufacture vaccine. So we started that journey about in 2018. It was a very tedious, tenuous, very hard journey. But we made it in 4 years, what other countries took over 10 years to make. And why is that so important? Because the board is in our hand. Whether it's dead or alive, it's left for us. But we are taking the bull by the horn in NAFDAC, that we're not going to let the board die in our hand. We're not going to let our pharmaceutical industry die. Because after maturity level 3, we are going to maturity level 4. By this time next year, we might have gotten maturity level 4. And what does that do for us? What it does is that it makes our own manufacturers in Nigeria to be globally recognized, because whatever products we approve with that status, we can use collaborative registration. We can use collaborative registration with other countries. Okay, yeah. We can use collaborative registration with other countries to hasten the registration of such products in other countries. We are also going to get to what is called the specialist category, world listed authority. Yeah, world listed authority. This makes us now stand shoulder to shoulder with US FDA. In order for our own manufacturers to trade, I believe in quality and I believe in trade. Without quality, you cannot have trade. And all the things we have been doing that led us to maturity level 3 and more, it is all about quality. We are placing emphasis on the health of Nigerians, not just the profit. We are not a culture that places premium on the profit more than the health. The profit is extremely important. And that is why we do what we do in NAFDAC. We have been very fortunate to have international partners that have come alongside with us. Global Fund, USAID, WHO is unbelievable in terms of what they've been able to do for us, technical and also financial, because we couldn't have done this by ourselves. In terms of vaccine manufacturing, I want to encourage my colleagues in the industry that it's going to happen, and it will happen faster than we think, because we have already in the industry companies that can manufacture vaccines. They've been manufacturing sterile dosage forms forever. So to migrate or to get into vaccine manufacturing will not be too much of a problem, but we are already preparing the industry for that. We are preparing ourselves in terms of training. Some of my staff are on their way to South Korea right now for biomanufacturing training. So I want to again congratulate PMG-MAN for taking this bold step to make sure that this meeting happened. I'm very proud of the industry because they have responded positively to our very hard regulations sometimes. They have responded positively. We have more confidence in our industry now than ever. We have international partners that are now, or international companies rather, that are now partnering with our pharmaceutical companies. If our companies are not of quality, they will not. And that is part of our strict regulation, the outcome of it. So I want to say thank you again for this meeting. And I know that if it is every 2 years, you should be sure that we will have gotten maturity level 4 and the world listed authority. And the last one that we have not gotten is a lot release for vaccine. And we are going for maturity level 4 there, not even maturity level 3. Because NAFDAC is no longer NAFDAC of yesteryears. We are focused, we are customer focused, and agency-minded and country-dedicated. Thank you very much.
Wow, thank you very much, the DG of NAFDAC. I would like to recognize the presence of the CEO of ABC Health Coalition. Is here present, so you're welcome. And the chairman of ACPN, national chairman of ACPN. And I can see here the immediate past president of PSN, pharmacist Ahmed Yakasai. Not immediate past? Immediate past. Wow. Pharmacist Yakasai, are that back in history now? Then the country chief party USP Quality Plus, pharmacist Mokpa Asuga. And we have the Honorable Commissioner for Katsina, ably represented by the Executive Director, DMA, Drug Management Agency, Mani Bala. Mani Bala, you're welcome all the way from Katsina. And we have Dr. Chibuzo Okpara, who is the CEO of Drugstore Nigeria. Talking about history, I take you back to the history of PMG-MAN. We have the former chairman of PMG-MAN, who 16 years ago, during his tenure, he laid the foundation for this Nigeria Pharma Manufacturers Expo that we're having here today. He's a fellow of the Pharmaceutical Society of Nigeria. Please join me to welcome pharmacist Emma Ebere. Okay, now back to track on receiving the policy statement by officials of the government. Next on my list is NIPRIC, and we have the DG here to do that, Dr. Obi Adigwe. Dr. Adigwe, please.
The Honorable Minister of Health, Dr. Osagie Ehanire, ably represented here by the Director, Food and Drug Services, Senior Director, Olubumi Stella Arabiana, the Honorable Minister, Industry, Trade and Investment, Otumba Adebayo, ably represented here by Director Francis Onora, my own president, PSN president, Action president, Professor Cyril Usifo, His Excellency, the World Health Organization country representative, Walter Kazidi Mulombo, as well as his very, very strong and effective team. And I say this because unlike I've been engaging with the WHO for close to 2 decades now, and I can say this categorically, that we haven't seen the kind of contextual interventions that we have seen prior to the engagement by yourself and your team. So I thank you, Excellency Walter Kazidi Molombo, and your team here led by pharmacist Hamzat Omotayo. My own chairman of the governing board of the National Institute for Pharmaceutical Research and Development, and also a very senior member of the society, fellow of various agencies and institutes and organizations, Dr. John Alpha, also a manufacturer, if I may say so myself. Although I don't know if you've joined PMG-MAN, sir. If you haven't, your card, your form is here. The chairman of the Pharmacists Council of Nigeria, Professor Mora, as well as the very senior team in the registry, the secretariat, led by pharmacist Baba Shehu, and all the very senior pharmacists and colleagues in the house, too many to mention, but I will single out Sir Ifeanyi Atweye, who has been in the industry for over 40 years. I didn't want to say 50 because you're looking very young and sprightly, and I didn't want to expose that. I know they've asked all the manufacturers to stand up before, but I will also, as a role of honor, and I say this because even though I've mentioned a long list of dignitaries from the ministries to the directors generals, I, from a very deep sense of humility, have a great amount of respect for people who manufacture in the pharmaceutical sector today. I was the executive secretary for close to 4 years, and I know that it takes 1/10 of the effort they put into manufacturing to import medicines. So anybody you see that owns a factory or that operates at a senior level in a factory, or like our immediate past president, Yakasai, has intentions of opening a factory, it is a national service. So can you all stand up for national recognition? Please stand up if you're a pharma manufacturer or are engaged with them. And can we give them all a long round of applause?
These are great patriots of this country.
Thank you very much. My address is going to be very short and to the point. I will tell you first what NIPRID has been doing along the lines of the issues that have been raised here today. And then I will end by giving 3 evidence-based directions which various stakeholders, who I will not be afraid to call their names, can take immediately in order to ensure that not just the pharma sector, but Nigeria as a whole advances the frontiers of medicine security. One of the first tasks I had as the DG of NIPRID was to represent Nigeria at Addis Ababa. And at that time, Nigeria had not signed on to the AFCFTA. And based on the experience I had gained, based on the tutelage and training I had gained at PMG-MAN, I advanced the concept of medicine security. Today, you hear many people mentioning medicine security without giving credit to where that concept came from. Let me make bold today in front of the world to say that PMG-MAN is the originator of that concept of medicine security. And using that concept, I made bold to say that within a few months, Nigeria had no choice but to sign onto the AFCFTA because it was a train that was moving and Nigeria could not be left behind. And based on that policy advisory, about 4 months later, President Muhammadu Buhari did the needful, and the rest is history. So NIPRID has been in the forefront of providing policy advisory. And based on that origin, and I think the people in NAIP can bear us witness, we've also led the position in articulating a strategy that can ensure that Nigeria emerges as the hub for key industries for which we have the comparative advantage. And number one in those industries is the pharma industry. Someone also mentioned vaccines and that the world was caught unawares by COVID-19. Let me correct that statement. It was the world minus PMG-MAN that was caught unawares. Because if you look back at PMG-MAN policy statements that were articulated even before I was appointed the executive secretary of PMG-MAN, you will see it very clearly. PMG-MAN predicted what would happen to Africa if we refused to build capacity in our local manufacturing sector, including vaccines. I remember that under the mandate of the former chairman of PMG-MAN, Dr. Ikeja, and under the leadership of the then chairman of F&GPC, Dr. Fidelis Ayebai, I gave a press statement which put the Ministry of Health on the spot when they went to import vaccines for meningitis. And it was after that the ministry, then led by Isaac Adewale, professor, signed an agreement with May and Baker for the first indigenous vaccines manufacturing entity. And I think PMG-MAN deserves credit for that action. The world indeed has a lot to learn from bold and intrepid policy directions that have been taken by this group. Similarly, I heard someone mention APIs, active pharmaceutical ingredients. One of the things I did when I was appointed Director General at NIPRID was to look through the interventions spearheaded by my predecessors. And I picked out those that needed to be brought to the fore, and I provided a strong advocacy direction for this to be brought to the fore. And it is on record that NIPRID, in the heat of the pandemic, secured the better part of $1 million from Afrexim Bank to set up the first API concept manufacturing and training laboratory in Africa. That is what NIPRID had been doing for APIs. As you all know, without APIs, where sector is not even existent. We all know how some of our trading partners banned the export of API in the midst of COVID-19, and this is an area where we pay a lot of attention to. There are a lot of other areas where NIPRID has undertaken interventions that will prepare Nigeria as emergence for the hub of pharma and phytomedicinal manufacturing in the midst of AFCFTA, but I will limit myself to just a few more. One of them being an intervention that was spearheaded by the chairman of my governing board, Dr. John Alpha, which culminated in Fitson Healthcare Limited, as well as PMG-MAN, giving an endowment, making a promise of an endowment to the total tune of 100 million naira. That has never, I can't see people clapping. Is it that you people are exhausted, or 100 million naira doesn't mean anything to you? This is the first time in the history of this country that manufacturers will give an endowment of this size to a research and development institute. About 6 products have now been concept produced, and Chairman, we will be seeking your audience shortly to present the interim progress to you. We also looking at ensuring that local manufacturers don't lose out when Nigeria gets intervention. As you all know, Nigeria is about to begin the multi-billion-dollar impact loan. And together with our partners, Bloom Healthcare, we will be unveiling a robust and comprehensive partnership with the industry. And even though I cannot unveil the details now, because that will be done by my minister, it is critical for you people to keep your radios tuned to this channel for that intervention. I now want to end the interventions by leeching on to what the Honorable Commissioner made. He told us very critically about the importance of our phytomedicinal and traditional medicine sector. It is on record that NIPRID, alongside its partners, has trained thousands of traditional medicine practitioners in this country. And in that regard, I would like to sincerely express our gratitude to the WHO, because the last edition was the one that was funded fully by the WHO, where a total of 130 traditional medicine practitioners were trained on best international practices. That particular report is on your desk now, WR, and we'll be visiting you to discuss further details on it. I now come to you can see the man rolling his hands. My interventions is about 5 pages long, so I will share it with other interested people, stakeholders at the end of the seminar. However, my 3 messages before I wind up. Number 1, to the Honorable Minister, Industry, Trade and Investment. I was really looking forward to the senior advisor being here to take notes, but I'm not worried because Director Francis Onora will do equally a good job. There is a need within the framework of the AFCFTA to protect majorly pharmaceutical sector lines. COVID has taught us that taught you people, it didn't teach us in PMG-MAN. It has taught you people that you cannot abdicate the responsibility for your health to others. But more importantly, and this is where I want you to take notes, Director Francis, in Africa, we like to enter interventions based on sentimental reasons. Nigeria pumps in a lot of money into agriculture, into a lot of other sectors. I don't have any problem with agriculture. After all, medicines and food security are Siamese twins. I have made that argument over and over again. But in the terms of the ranking of industry, the East Africans have a comparative advantage when it comes to agriculture. Why are we protecting and spending funding in that sector more than in sectors where we own the comparative advantage? In terms of pharmaceuticals, and the executive secretaries of PMG-MAN, whose job it is to go to factories across Africa. Olakunle Okelola is here. He can bear me witness. The new executive secretary, Francis, is here. He can bear me witness. across Africa today, in terms of the number of factories, in terms of the number of pharmacists, in terms of the number of importers who can translate their importation capabilities to emerging factories through contract manufacturing, in terms of so many other areas, nobody has the advantage that Nigeria does. And because of that, when my dad used to tell me stories in those days, he said, if you had 5 or 6 children, and you had limited resources, you will pay school fees for the one who was most intelligent so that he will graduate and use the money to train his siblings. If Nigeria must prioritize one sector, it is the pharma manufacturing sector. Please take that message back. The second message I have is for the Federal Ministry of Health and PMG-MAN. We keep talking about people making policy statements, people unveiling policy tools, without doing an M&E of the policy statements and the policy tools that already exist. And I will give you one example. There are about 10 of them, but in the interest of time, I'll give you one example. In the Executive Order number 3, in Section 4F, Dr. Ikeja, former chairman of PMG-MAN, current president of WAPMA, is seated here. So if I lie, he can call me out. PMG-MAN leadership specifically made sure that pharmaceuticals was mentioned in Section 4F of an executive order. The executive order says that all government agencies, all government entities must prioritize procurement of pharmaceuticals that are made in Nigeria. I know for certain that that is not being done. How many times have we, either by advocacy or by way of putting together a research project to collect the evidence, analyze the evidence, and submit a report to the president who puts forward? It's called an executive order. It's not called an executive guideline. It's called an executive order. And I know that there are hundreds of teaching hospitals, federal medical centers, state government-owned entities. I also know that there are about 600 to 900 MDAs, of which close to a third or half of them own clinics. Why are we not reviewing what percentage of the procurement is made in Nigeria? With that singular action, we can move procurement of medicine, made in Nigeria medicines from 30% to close to 60-70%, because that is a demand that Professor Osinbajo, when he was acting president, gave as an executive order. And I don't think PMG-MAN and the ministry are doing enough yet to follow up on that. The third one and the final one, because I know the gentleman is now impatient, goes to all of us here. And that is in terms of investing in our phytomedicinal and pharmaceutical manufacturing entities. When I said all manufacturers should stand up in a room that was filled with pharmacists, it wasn't just to praise them. I also wanted to do my own empirical count of people who were investing in this sector. And I must tell you, ladies and gentlemen, excellencies, that it was disappointing. We must do more to invest either directly or indirectly in industries that harness our pharmaceutical manufacturing and phytomedicinal development sector. I know not less than 20, 30 people who are not in healthcare that produce teas. So they get hibiscus, they get zogali, and they create teas, and they are making money. They're not just making money, they're contributing to healthcare delivery in Nigeria. Why are we not doing more in terms of investing in these two conjoined and immensely lucrative sectors? And in alignment with that, how many of us buy made in Nigeria medicines when we go to pharmacies? And I think the chairman of the ACPN is here. Each time I go to a pharmacy shop and I ask the salespeople there, give me a particular medicament, the first that they're very quickly to put in front of me is either made in the UK or made in Asia. I have to ask to say, don't you have made in Nigeria? People need to people need to understand that until we, as a culture, as a people, focus on buying things that are made in our country, we will continue to export our socio-economic development, jobs, capacity building, and revenue generation. Finally, let me once more congratulate and commend PMG-MAN and their partner, GPE Expo PVT. The last time I did this was in 2016 or 2017. And I was very surprised when I came in and Frank and Mr. Pares Jumavala were looking as cool as a cucumber. And I'm like, it seems this process is not stressful enough. I think that goes to show that they have done a lot of work in the background to put together this excellent conference and exposition, and they indeed deserve commendation. I thank you for your attention.
Wow, please put your hands together for the DG of NIPRID. We see his excitement having been in PMG-MAN and also now in NIPRID. All right, so move to another lucrative sector of the high table, which is this side. And I would like to begin with the Pharmacists Council of Nigeria. I would like to invite the chairman of the Governing Council, Professor Tijani Mora, please.
Thank you very much. I listened carefully to the DG of NIPRID, a member of the Governing Council of the Pharmacy Council of Nigeria, and my younger brother. I've never seen him this excited, honestly speaking. But no wonder, because he has been one-time PMG-MAN secretary. So, and rightly so, he really exhibited a lot of passion in the presentation. Thank you very much. Now, the Honorable Minister of Health, the Honorable Minister of Trade and Industry has represented the Excellencies, the High Commissioners of Bangladesh and India, the Chairman of NIPRID, the representative of WHO, the DG, NAFDAC, my sister, the President of the PSN, distinguished invited ladies and gentlemen. I am here as the Chairman of the Pharmacy Council of Nigeria. And wow, this is an inspiration because my sister is just coming in now. Stella Okoli is just coming in now. One time, you are coming from Lagos, okay. I have spoken with you now because I know you're here. So, come, you come up. No, I have to wait. I have to wait for you. Okay. They will do the needful. Well, I'm here actually with the Registrar and Chief Executive Officer of the Pharmacy Council of Nigeria, the brand new pharmacist, Ibrahim Babashehu Ahmed. Can you please be upstanding? There is also the Zonal Director of Lagos Zonal Office of the Pharmacists Council, Dr. Ukamaka Okafo. There is Director of Inspection and Monitoring, Dr. Taiwo Fulusi. I can see that you are having a very good chat with the MD of Daily Need. Please keep it up. Okay, and you may wish to observe that I say Pharmacy Council, no longer Pharmacist Council, because His Excellency President Muhammadu Buhari has signed the bill into law. Now we are now Pharmacy Council of Nigeria. This was on the 16th of August, and it has been gazetted. There are so many similarities, and there are so many differences between the old Pharmacist Council, now repealed, and the Pharmacy Council. The registrar is no longer secretary, he's also a member of the council, among other functions. My sister, DG Nabdak, is a member of the Pharmacy Council, and also we also have the 3 representatives of the pharmacy technicians as members of the council. Now, I'm sure you know that we are responsible for the regulation and control of pharmacy education, training, and practice in all aspects and ramifications, and including the inspection, registration, approval, and licensing of all pharmaceutical premises in this country, which include all pharmaceutical manufacturing facilities. That is why we are here, and rightly so, and we thank the leadership of PMG-MAN, my brother, Dr. Fidelis, for this invitation. That's why I'm leading a very high-powered team to come here to express our appreciation and to support the PMG-MAN in its drive of sanitizing and, like Dr. Obi said, of ensuring medicine safety, not only in Nigeria, but in West Africa. It is my pleasure to be here on the occasion of the Nigerian Pharma Manufacturing Expo by the Pharmaceutical Manufacturers Group of the Manufacturers Association of Nigeria. I'm most grateful to the chairman of PMG-MAN, Dr. Fidelis Aebe, for this invitation. I'm equally appreciative of the endorsement of the Secretary of the PMG-MAN, Frank Monoime, and members of the Executive Committee for this privilege and honor done to me to serve as one of the special guests. Let me congratulate the entire membership of PMG-MAN for yet another edition of NPME. In my book, The Leadership Model in Drug Distribution in Nigeria, second edition, which was presented in Ikeja, Lagos on February 2018, under the chairmanship of Dr. Stella Okoli, I listed the members of PMG-MAN from pages 57 to 76. The members of this highly distinguished body were 90 at that time, but as we heard earlier, today the membership has grown in leap and bounds, and we're talking about 126. Nigeria is the leading country in terms of manufacturing of pharmaceutical products in the 15 countries making up the Economic Community of West African States. Besides, with a population of about 220 million Nigerians, it is only proper that the PMG-MAN should be concerned about the availability of basic pharmaceutical products and medical devices in Nigeria. I'm pleased to note that manufacturers of equipment and machinery involved in the pharmaceutical production facilities, both at home and from abroad, are participating in this 2022 edition. On a personal note, this event reminds me of my days as a pharmaceutical manufacturer in 2 facilities too. First is MD and CEO of the biggest disposable syringes manufacturing company in West Africa, the Zaria Pharmaceutical Company Limited, that is manufacturers of Zaria Inject disposable syringes and needles, from 1997 to 1999. I was then the project coordinator of this. I was earlier the project coordinator and supervised the installation of equipment and machinery from 1993 to 1996. The other facility is the Zozo Pharmaceutical Industries Limited, manufacturers of generic and branded solid dosage and liquid pharmaceutical formulations, also in Zaria, Kaduna State, from 2000 to 2003. That both factories are no longer producing brings me to the theme of this NPME, which is advancing the frontiers of medicine security in Nigeria, expanding the local pharma manufacturing in the era of African Continental Free Trade Area of AFCTA. I recall that I was deeply involved in the establishing of the first medical and sterile products Nigeria Limited, the manufacturers of fast-made disposable syringes at the Calabar Export Free Trade Zone. So we are talking about free trade zones, and we're talking about Africa Continental Free Trade, which is quite appropriate. Despite the growth in the number of pharmaceutical manufacturing facilities in Nigeria over the years, the life cycle within the industry is anything but impressive. With high turnover in the introductory and decline stages across the pharma industry, the PMG-MAN should study the trends and articulate strategies towards ensuring near immutability of pharma industries in Nigeria. I cannot conclude these opening remarks without throwing a challenge to the leadership of the PMG-MAN, which has done excellently well under its present and past leadership. Thank you, sir. A, the PMG-MAN should ensure steady supply of basic and life-saving pharmaceutical products in Nigeria. The chairman and members will recall the webinar Zoom meeting between the Honorable Minister of Health, Dr. Osagi Ehanire, in December 2021, and the manufacturers of intravenous fluids in Nigeria, which the Honorable Minister directed me to organize. That Nigeria will find itself in short supply of such life-saving products as intravenous fluids was disturbing. The less than 10 manufacturers of IV fluid in the country has done wonderfully well, though, in investing in the production of this critical life-saving consumable area. To avert future occurrence of such shortages, I want to advocate for the bulk procurement of IV fluids, Mr. Chairman, of PMG-MAN, and other life-saving pharmaceutical products, the same manner and way that strategic grain reserves are procured. At near expiry, the government can release the products to its hospitals, and same can be dispensed or used on patients as the case may be. This will equally ensure price stability of finished products. As a former manufacturer of disposable syringes, I want to advocate the same approach for syringes too. You need the devices, that's medical device to administer fluids. Again, there are less than 10 of such manufacturers of disposable syringes in the country, and we can do more in this sector. The issue of availability of APIs that DG Napi spoke about is another issue that the leadership of PMG-MAN must address by way of local manufacture. As the saying goes, and I quote, you cannot effectively control what you do not produce, end of quote. I just returned from Tampa, Florida, USA, where I attended the 2022 annual scientific conference of NAFSA. And on the sidelines, a small group discussed the issue of lack of availability of lack of APIs in Nigeria. I added that excipients and other additives are equally important. A committee has been formed with myself as a member to interface with key stakeholders in Nigeria towards the local manufacture of these APIs, excipients, and additives in Nigeria. The name of PMG-MAN, of course, featured prominently among such stakeholders. I will be getting in touch with the PMG-MAN towards this. Former president of NAFSA, Dr. Enke Ebube, is promoting this initiative under the broad objectives of NAFSA in interfacing with the pharma industry in Nigeria. The issue of custom duty on APIs, excipients and packaging materials, and labeling materials is another area to look at towards lower duties, which will ensure affordability of pharmaceutical products to patients and users. With these few remarks, I thank you very much for this opportunity to share my thoughts with you. Thank you for listening, for your attention. Thank you and God bless. Thank you.
Thank you very much, the chairman of the board of the Governing Council of the Pharmacy Council of Nigeria. Yes, you've for that. So still on this side of the table, we'll go to the Pharmaceutical Society of Nigeria. We invite the president, Professor Cyril Osifo, to make his remark. Professor Cyril Osifo, please.
Thank you very much. One of the things I've learned as a teacher and actually a professor of over 20 years is that when you give your lectures, after a particular time, your students will switch off. And we have people, the students who are here are much, much older than the students who are planning to return to school. So I will try to abridge what I am going to discuss with you. Let me toe the line of my good friend and brother, Professor Mora, to say I'm not here alone. I can see the landlord of Lagos State. The Lagos State PSN chairman is here with us, Iyola. And our national secretary, Prince Falabi Benga, is also here. The secretary of BOF is here. Among others, I can see Nikoro and others here. I am believing that I'm standing on existing protocols so as to redeem time. Two things I want to bring out very clearly. My brother and chairman of PMG-MAN said there is no forex to import API and equipment. High tariffs on imported commodities and huge investments, if not protected, may be threatened, and also jobs. PMG-MAN for coming up with this Expo and its partners is a very good thing. But I want to speak on the part of the manufacturers that they are passing through a lot. I've interacted with a couple of them, and government needs to change policies to enable them execute this issue of medicine security in the country. My big sister, Dijima, and my WHO wonderful person, forgotten your name. You talked about the bird in the hand that may be dead or alive. And if alive, especially among the pharmaceutical industries, I want to make bold that this bird is bleeding. This bird is sick. This bird might be in coma if nothing is done. Policies must therefore be created while advocating for quality of drugs to create an enabling environment for our industries to be able to compete globally. That is my plea, and I'm ending that by recognizing the chairman of the occasion, who is representing our Honorable Minister of Health, who is my brother, being represented here by my in-law, our pharmacist, Arabi. Take the message to him that we are saying the pharmaceutical industry need government policy to enable them compete globally to produce high-quality drugs. Thank you very much.
Before I could even say Jack Robinson, you are true. Thank you very much for that, Prof. All right, so just to switch us on, can we just rise to our feet, so that blood will circulate? Let's wake up. Wake up, yes. You can stretch like this to your right and then to your left, yeah. Then maybe you can tell the person on your right you are welcome, and the person on the left you are welcome. You may want to also know the name of the person on your right and the name of the person on your left. And we go around and investigate if you have these two names. All right, thank you. Now you may sit down. You may sit down. Thank you very much for complying to that. Yes, yes, yes. Thank you very much. You may sit down now. Now, before we listen to the representatives of the ministers here present, we would like to give some airtime, quality airtime, to the chairman of the board of NIPRID, our own Dr. John Alpha, to say a few kind words. Dr. John Alpha, please.
Thank you very much, MC. Hello? Thank you very much for this opportunity. The chairman of this occasion, I would like to stand on the existing protocols. A few remarks. My DG has spoken so well, and Dr. Obi is somebody who is an influencer when he speaks. And if you are in occasion, pray that you speak before him. So he has spoken so well about a lot of activities we are doing. I will just amplify a few and then make additional comments. Before I do that, I'd like to congratulate PMG members, PMG-MAN members, for, again, as he highlighted, the bold decisions to be in manufacturing. It is a very difficult thing. I know that most people who are there are not there because of the money, but they are there because of the passion. Secondly, the APIs that he mentioned, the API is very much uppermost in the thoughts of both the board and the management of NIPRID. And the moment we got there is one of the charges that we gave him. He has talked about one. As far as SCPN development is also concerned, he forgot to mention that part of the fund that came in from PMG-MAN and Mr. Felix, Dr. Felix, the chairman of Facing Healthcare, Fidelis, sorry, was also used in development of starch. And as we speak, we are almost there getting pharmaceutical grade starch. I thought we were going to clap hands to that. For those who are importing starch to this country, it will not be a good news for them, but we cannot be subservient to other places all the time. We must also wake up and step up our games. Then, as far as the APIs is concerned, whatever story we keep on telling about APIs, if we don't have the basic raw materials for development of APIs, we have not started. I visited India a few months ago, and I was opportune to visit some API factories. And I was also impressing on them to come and set up API factories in Nigeria. And one of the cardinal questions they asked me is that, what about the basic raw materials? Do we have them? And the answer, the truth is that we don't have most of them. Many years back, before I graduated from the university, 2080, 2081, we were told that because of the petrochemical that was coming in, it was going to roll out, the third phase of the development was going to roll out the aromatics and aliphatics. The phenols, the paraaminophenols, and all those ones that will enable the synthesis. And I've done my civil service for 35 years, and I retired about 4 years ago. And when I kept on asking from the NMPC, I've been able to get answers as why this has not been done. And so we need, I'm happy that the representative of the Honorable Minister is here. This is one of the things we also expect you to take there. We need a policy direction and also enabling action that will make the petrochemicals to roll out the ground materials that are necessary for the APIs. Otherwise, if we have to import all those ones, our prices are still going to be higher than the ones we are importing. And so it's very important that we look at this direction. And so I want to appreciate EMSO Pharmaceuticals for taking that bold step in establishing the first API industry in Nigeria. I think we should give her a clap. Thank you, Madam, for standing up. Hallelujah. Hallelujah. So we need more of her to come into the industry so that we will be able to roll out the APIs. And still on the API, I've just talked about the chemical type of manufacture. And the chemical industry and the petrochemicals need to be boosted in that area. Then isolation and purification. That one is derived from animal organs, tissues. Of course, for those who also wanting to go into API, this is an area you can go into. Then extraction, as you talked about, the phytomedicines, so that we can also have active pharmaceutical extracts. And lastly, the biotech stroke fermentation of cells and culture. That is derived from master and working cells banks. So the area is still a virgin area, and we also encourage people to go into these areas. On that note, I want to thank the chairman of PMG-MAN for this opportunity to give the goodwill message, and also to congratulate you for this well-organized event. And thank you all.
Thank you very much, sir. Now, before I hand the microphone over to the representative of the ministers here present, I would like to give 30 seconds to a few agencies to give a goodwill message. I'll be timing you for this. So I'd like to begin, yes, 30 seconds, maybe 1 minute. All right, we'll start with the president of WAPMA, Okay Akpa. Okay, Akpa? Yes, your time starts now. Just to say a goodwill message. We just need to hear your golden voice. 30 seconds, yeah.
Well, I think our time is fast spent. I'm actually surprised we've taken so much time. Just to say, well done, PMG-MAN. Congratulations, PMG-MAN. WAPMA stands for West African Pharmaceutical Manufacturers Association. I also sit on the board of Pharma. But just one word, like the DG said, and DG WHO said, and NIPRID DG made an analogy of the brilliant child who must lead. It's not controvertible that Nigeria is key in the scheme of things in Africa. And when I sit on the board of Pharma and WAPMA, one thing is clear. We must not drop the baton in Nigeria. From regulatory to the industry to the ministry, when we go weak, Africa goes weak. When we go strong, Africa goes strong. And that is why this Expo is important to me. So I want to thank PMG-MAN chairman for, against all odds, insisting that we put it together. I want to thank Paresh for all our agents. As a past chairman of PMG-MAN, and the past chairman is here, and Amzo is gone, our vision is that the first CPHI in Africa will be in Nigeria.
Wow, wow.
And we are almost there. If not for COVID, by this time, the partnership between Paresh and CPHI and all that will be seeing Nigeria host the biggest show in pharma. When Dr. Digo was talking about Nigeria being in an advantage position, I'm in a position to say that. So I want to say thank you, Mr. Chairman. Thank you, DG. Thank you, everyone, for coming. Thank you, Ministry, and my big sister. God bless you. Let's go and do some business, guys.
Yeah. To do business. So we just listen to the National Health Insurance Authority, and I have the authority to tell you have only 1 minute.
Thank you so much, MC. I would like to stand on existing protocol just because of our time, but I will feel a little bit slighted if I had not been given this opportunity to speak here today. The Honorable Minister of Health, ably represented, Honorable Minister of Trade and Industries, please, I want to welcome each and every one of you here. National Health Insurance Authority happens to be one of the biggest partners for today with PMG-MAN, and that is why we need to highlight it, because we have actually taken a bold step to make sure that drugs manufactured and distributed under the National Health Insurance Authority are produced locally. And one of the things that we have done since the Director General assumed in 2019 is to set up what we call a medicine supply initiative. And we have gone through a lot of process in partnership with almost every organization that is here. We are actually at the tail end of it. And one of the things that we have made as a criteria is that any manufacturer that will partake in this process must be a member of PMG-MAN. And I think that's the right step in the right direction. I want to congratulate you once again, and I want to wish you all the best. And I look forward to more partnership with more manufacturers, especially in terms of drug distribution for the National Health Insurance Agency. Thank you so much.
Thank you. Wow, giving you the mic was a step in the right direction. So we move to the representative of the Honorable Minister for Federal Ministry of Industry, Trade and Investment, Francis Onora.
Yeah, thank you very much, and a very good afternoon to everybody. It's been a long day, and it can only be the pharmacist who will keep you seated for this long, keep you interested, keep you very, very much committed. The Honorable Minister of Industry, Trade and Investment, Otumba Niyi Adebayo, CON, asked me to convey to you all his apology. The minister is presently attending the ministerial retreat with Mr. President. He has, however, put together his thoughts in the speech which I shall read to you after now. The representative of the Lagos State government in absentia, the representative of the Honorable Minister of Health, Director Generals of NAFDAC, NIPRID, and all the Director Generals here present, representatives of the WHO, representatives of other governments, Chairman of PMG-MAN, President and Chairman of professional bodies present, professional pharmacists, captains of industries, distinguished ladies and gentlemen. It is my pleasure and honor to be invited to this event. And I would like to begin my remarks by appreciating the initiatives and efforts of the Pharmaceutical Manufacturing Group of MAN for hosting this event, which has become a permanent feature in the calendar of many, including my very self. I am sure we have all come to this year's event with great expectations to learn the latest in pharmaceutical manufacturing techniques, equipment and machineries, as well as to deliberate on the theme, advancing the frontiers of medical security in Nigeria, expanding local pharma manufacturing in the era of the African Continental Free Trade Agreement. Distinguished ladies and gentlemen, I would also like to use this opportunity to salute the commitment of members of PMG-MAN for ensuring that Nigerians have access to affordable and high-quality medicines, which was very evident during the COVID-19 pandemic. This is in tandem with the desire of government to build a robust health sector through public-private partnership by strengthening health systems, developing human and financial capacities, as well as other needed resources to achieve the objective of improving health and reducing inadequacies while responding to the needs of the health sector. The Nigerian pharmaceutical industry have achieved a lot in the last 2 decades. Not only have we obtained self-sufficiency in many areas of pharmaceutical formulations, we have also maintained the leading position in pharmaceuticals in the West African sub-region, with over 50% of locally formulated drugs in the sub-region. These statistics put Nigeria ahead of many other pharmaceutical producing countries in East and Central Africa, next only to the South African Republic and the southern sub-region of Africa. The gains recorded in the Nigerian pharmaceutical industry can largely be attributed to government support through deliberate policies and programs designed to prioritize local production of medicines and affordable medicaments. Government has equally ensured that the pharma sector continues to enjoy various fiscal policy incentives, concessions, and waivers for importation of needed raw materials and machineries and equipment for production of drugs and medicaments in the country. Pharmaceutical products also enjoy priority position in the implementation of the Executive Order 003, which ensures the local patronage of goods and services produced in the country. These measures and more are intended to reduce the cost of production, to promote quality and sufficient medicines, encourage expansions in the pharma industry, boost competitiveness and market access of locally manufactured pharmaceuticals, not only in Nigeria, but across the West African sub-region and beyond. The African Continental Free Trade Area Agreement, AFTA, presents a golden opportunity to deepen market access of made-in-Nigerian pharmaceutical products. What is required at this time is the strategy to make this happen. It is on these notes that I invite participants and discussants in the course of this program to reflect deeply on the theme of the Expo with a view to come up with actionable plans on how Nigerian pharma sector proposes to partner with governments to actualize Nigeria's vision for the AFCFTA. Currently, at the level of the ECOWAS, there are ongoing negotiations to harmonize import tariffs in key sectors where there are capacities to produce pharmaceuticals in Nigeria and across the West African sub-region. I wish to invite the PMG-MAN to key into this process as it is the right direction for us to access the African market under the AFCFTA. The ministry is not unaware of the challenges and deficiencies in the Nigerian economy. But however, concerted efforts are being made towards addressing these issues. My ministry, in collaborations with other stakeholders, will continue to support the industrial sector and indeed the Nigerian pharma sector as we remain committed to the goal of a prosperous Nigeria through industrialization. Distinguished ladies and gentlemen, since the last 10 years, the focus of my ministry for the pharmaceutical industry was to build capacity for the local production of active pharmaceutical ingredients and vaccines. The events of the last 2 years have further necessitated the need to reinvigorate efforts in this direction. I wish at this point to commend the efforts of members of the PMG-MAN in this regards and to encourage you to sustain the tempo until the goal is achieved. I wish to use the opportunity of this speech once again to salute the organizers of this event and to also thank all of you who have graced this occasion. I wish you all fruitful deliberation, and I hope this year's Pharma Expo will unlock untapped potentials in the pharma sector for national development. Thank you, and God bless you all.
Thank you very much for that brilliant speech. Professor Tijani Mora talked about his book. You want to say one more thing about that book?
I actually, when I was delivering my paper, I said, I mentioned the numbers of the members of the PMG-MAN as 2018, which I mentioned in my book, which was presented to the public in February 2018. So I have some copies here which I want to present to the PMG-MAN so that you can have it in your library.
All right.
Consulting.
Yeah,
Yes.
the president of PMG-MAN,
see here?
Dr. Fidelis.
It's not here. Okay, why the
Secretary General, Frank. Are you moving around? Where is he? All right. So
I give it to you?
They're on their way. It might not get to them, but anyway. They will come and receive it. 1 minute. All right. So before we invite the the chief guest of honor to do the opening, official opening properly, we would like to hear from the Consul General of India. He's here present. He wants to say a few words. So, Ken, please.
Thank you. Good afternoon, dear Good afternoon, dear Excellencies and the representative of high offices. I acknowledge the presence of Director General of NAFDAC, and I have been only here 2 months in Lagos, so I have problem in remembering the name of dignitaries. So I would say that protocol is observed, and I recognize all of you at the high table. I also congratulate the organization, Mr. Paresh, the chairman of PMG-MAN, and all the manufacturers who are present here. They are the real backbone about the thing which we are talking about. We have to manufacture locally. It has been known to us since the time of COVID. I took some time to go out and saw some stalls, and 84 Indian companies are there, and they are there with all details that the right person can connect with them, and the manufacturing unit come as a turnkey project. So this is the real thing. The real thing is that every machineries are available in India, and that can be sourced. The permanent secretary told that we don't have to reinvent wheel every time. Okay, your fellow nation India has gone some distance. Why not to collaborate with them and take this further? And they are there in full esteem with 84 companies here with all the necessary manufacturing tools and techniques. They are experts, there are consultants who can help. So I welcome those companies also from the Indian consulate side, and I exhort all of you to take the benefit and do the collaboration with Indian companies. And I'm 100% sure that that is going to be very fruitful. And one small thing I would like to say, some time back, you all remember that Serum Institute of India has signed MOU with Nigeria to produce vaccine in Nigeria. So it has been done already.
Wow.
So with this note, thank you and wish you all a good business. Thank you, Dignity.
Thank you very much. In other words, it says India has been exported and is just next door, right? No need for visa, no need for Zoom meetings. You just move next door and you get all you need to find from India right there. So before we move there to India, right, to network and get all the contacts we need for our business, we would like to have the official opening of this Expo, and we would like to invite the chief guest of honor of this occasion, the Honorable Minister for Health, Dr. Osagie Ehanire, ably represented by pharmacist Olubimi Arabiana. Madam, please do us the address and officially declare this occasion opened.
Thank you very much, the moderator. Good afternoon, everyone. The Honorable Minister of Trade and Investment, ably represented, the WHO country rep. The Ministry of Health can't really do much with WHO. And wherever we find ourselves, we first recognize the impact and the support of WHO as far as Nigeria is concerned. So, sir, we want to thank you very much. The DGs present here, the chairman, PMG-MAN, the executive directors of the various pharmaceutical industries, the senior colleagues in the pharmacy profession, distinguished colleagues and gentlemen of the press. Permit me to read the speech of the Honorable Minister. But before I commence, I want to say today is a family gathering of both the local and international members, with our friends supporting us. And because it's a family gathering, we need to tell ourselves the truth, what we have done right, and what we need to improve on. And I want to say sincerely that be thou as it may, the government has done, I wouldn't say excellently well, the government has done well. Why am I saying the government has done well? NAFDAC is a baby of the government. NIPRID is a baby of the government. NHIA is a baby of the government. And all these organizations All these organizations are working tirelessly to ensure that the pharmaceutical sector moves to the heights that we all want it to be. And what is it? Sustainability and resilience. And so when we now say government, 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 I sit back and I wonder, this government, is it not trying? Let's appreciate government for once. I'm not hearing a good appreciation for the government of Nigeria, because we are really doing a lot. Now, I want to say something. The DG NIPRID said that the government is not actually, or we are not getting a percentage of the government's patronage of the local industry. I want to categorically make this statement that the tertiary institutions are autonomous. The secondary institutions are under the state government. The primary healthcare are actually under the local government. And in our own sense of ensuring that the local industries thrive at the national level, we set up the National Supply Chain Management Agency. And they are working with AROC, I think AROC is in the house, with the various state governments in developing their sustainable medicine distribution system. And the key to that is PMG-MAN. I don't know if PMG-MAN can say, stand up for that. PMG-MAN is working closely. So I think if there is an analysis carried out in country today, we will be talking about 60% of patronage from the government of Nigeria. So I think we deserve a resounding applause, please. Another one, before I read the Honorable Minister's speech. Oh, he can bear us witness that they are working closely with the state government. And the federal government is really not into procurement per se, but I can say that what we do at the national level is more of donor funds. And the reason the local industry is not benefiting from that is one of what we are discussing here today. And what is it? The WHO pre-qualification. Anytime you say we need to source our products locally, they tell you how many companies are pre-qualified in Nigeria. And even if we had companies that were pre-qualified before and NAFDAC had not attained ML3, they will still not allow us continue. So however, we have to thank WHO working closely with NAFDAC to ensure that NAFDAC has attained maturity level 3, and the government is working tirelessly to ensure that we get to maturity level 4 and we are listed. And once we are done, I can tell you the sky is our limit. Another thing I want to say is the African Free Trade Zone. Doesn't pose a danger to us. It is an opportunity. We have 200 million population in Nigeria, and the earlier we get our house in order, that is to say, even if it's just 5 companies in Nigeria being able to attain the WHO pre-qualification with NAFDAC, we will rule Africa. That I can assure you. We will rule Africa. We have the population, we have the resources, and we have the human capacity to do everything that we want to do. So all we can say from the federal government is to encourage the manufacturing sector to do the needful, and the time is now. So as many as are ready, I know my friend and colleague Amzat will work tirelessly with you to ensure that WHO pre-qualification is attained. Thank you. And then I read the Honorable Minister's speech. I feel highly honored to be invited to the 6th Nigerian Pharma Manufacturing Expo as a chief guest of honor. It is indeed with great pleasure that I join industry giants who have devoted enormous resources to ensure that the Nigerian pharmaceutical industry continues to produce quality, effective, affordable medicines to the Nigerian populace and beyond. Let me use this opportunity to commend the organizers of this event for the choice of the theme, Advancing the Frontiers of Medicine Security in Nigeria, Expanding Local Pharma Manufacturing in the Era of African Continental Free Trade Zone Area. The African Continental Free Trade Area is the world's largest trade area and brings about 55 African countries and 8 regional economic communities. Nigeria, with a population of over 200 million people, stands to gain a lot from the African Free Trade Area. This brings to the fore the urgent need for our pharmaceutical companies to fervently pursue WHO pre-qualification in order to prevent a scenario of Nigeria becoming non-competitive in the continental market. You are all aware of the efforts of the government towards the recent attainment of the WHO maturity level 3 by the National Agency for Food, Drug Administration and Control. This allows our locally manufactured pharmaceuticals to be accepted internationally. NAFDAC is currently working on lot release, which would allow for local manufacturing of vaccines and its marketing. The government is also supporting NAFDAC in its efforts to achieve maturity level 4. All hands must be on deck to actualize WHO pre-qualification of our pharma companies. More than ever before, the COVID-19 pandemic has taught us all a great lesson that every country will take care of itself before it thinks of the others. In what is now tagged vaccines nationalism, our country and other medium and low-income countries saw firsthand how countries stopped the exportation of some active pharmaceutical ingredients just at the beginning of the pandemic. The pandemic caused massive disruptions in global supply chain and brought to the fore the dangers of relying on imports for most of the medicines and vaccines consumed in the country. All efforts should be geared towards ensuring Nigeria meets its desire of self-sufficiency within the shortest possible time. Only local manufacture of pharmaceuticals and other therapeutics can guarantee medicine security, which has long been identified as an integral part of national security architecture. The federal government, through the Federal Ministry of Health, is working towards filling one of the major gaps in the pharmaceutical industry, which is the local production of active pharmaceutical ingredients through the development of policies that will attract pharmaceutical investors to address this need. I stand to say that the role of the federal government is to develop policies and programs, while the agencies will implement. In terms of active pharmaceutical ingredients, it stops at my table as Director of Food and Drugs. I want to assure each and every one of us that any company that is able to come up with one, that product will be listed under the import prohibition list. It will be listed under import prohibition. Someone has once told me that we cannot compete with the international companies that are involved in this. I said we will compete with them using our policies. And once we have companies that we can identify is into 1, 2, 3, they will be included under the import prohibition list. That is to say, whatever amount it is in the market, just as we are buying local rice for 39,000, so also we will buy our active pharmaceutical ingredients with our resources here in Nigeria. The National Institute of Pharmaceutical Research and Development, NIPRID, is in the process of completing the first ever API pilot facility to develop and initiate local production of active pharmaceutical ingredients. This facility, when completed, can provide a starting point for API pilot production in Nigeria. It will also serve as a facility for practical training of the required human capacity for the development of API industry in the country and the sub-region. This will be a significant step in transforming the pharmaceutical industry in the country into a sub-regional manufacturing hub. Furthermore, the Federal Ministry of Health is working towards the development of the first ever national strategic plan for the Nigerian pharmaceutical manufacturing sector. It is ongoing. PMG-MAN is part of it. But I want to say categorically, well, when serious documents are being developed, please ensure you bring people that will contribute meaningfully so that at the end of the day, it will be implementable by each and every one of us. When we send people who just come to do tea break and lunch and go, at the end of the day, the policy will be binding on all of us. So I want to advise that we do the needful. Furthermore, you would recall that one of the recommendations of the Presidential Committee on the Pharmaceutical Sector Reform was that the local industry should be assessed on a 2-yearly basis, and drugs it can manufacture in sufficient quantity should be included in the import prohibition list. The Food and Drug Services Department is in the process of resuscitating this committee and reviewing the recommendations made to address the current challenges. This is a call to the industry to expand its scope of manufacturing to support the drive for inclusion of more drugs on the import prohibition list. Once again, I would recommend commend the industry, especially at this time of our national existence, when forex infrastructure has become a national challenge. We stand with the pharmaceutical industry experts' position on access to forex in order for the country to benefit the full potentials of the industry. Furthermore, I would like to appreciate your esteemed association for the support given to the ministry and to assure you, sir, that they will be put to good use. I won't say much on that. Finally, I want to reiterate the federal government's drive to support the industry, and also want to categorically state that the federal government policy direction is local production of all pharmaceuticals, medical consumables, and medical devices. On this note, I once again congratulate PMG-MAN while wishing you a successful pharmaceutical event, and by the power vested on me today as the Minister of Health, I declare this event open.
I think the Honorable Minister of Health deserves a standing ovation, please. Yes, in that capacity. And thank you for declaring this occasion open. So you may sit down now. We'll listen to the vote of thanks, after which we move to the opening ceremony of the exhibition stand. Now, Maura, PMG chairman is here to receive the books. And then, okay. You want to say something more?
Yes, I think it's only proper that I make this public. This is the contribution in respect of a system approach to drug distribution in Nigeria, which was first launched in 2014 and relaunched again in 2018, the leadership model in drug distribution in Nigeria. And it's my pleasure to present 10 copies to PMG-MAN with the hope that it will be distributed and then they can make use of it to have a system approach in terms of drug distribution in Nigeria.
Okay, we'd like to invite the PMG-MAN Management Committee, Mr. Oluwatosin, to give the vote of thanks. While he's walking to the podium, we would like to hear one sentence from the chairman of Mopsin Pharmaceuticals Limited, Dr. Michael Oyebanjo Paul. One sentence. You want?
Please. What I want to say is that the Minister of Information is here, and the Minister of Health is here. Everything you are talking about fails when there is no foreign exchange. There is nothing about everything we are saying here. And once the foreign exchange is not there, you are not talking. And it's not part of it. So what I want to say, can you ask your ministers to make a special allocation of foreign exchange for pharma industry, since pharma industry is a security issue in Nigeria. And therefore, you must provide the means of communication, of transaction. If you have nothing to say, I must let you know that today, dollar is 750. The official rate is what? 420. So that extra means half of your money is gone. So you are depleting the capital of the manufacturer. Every day you are depleting their capital by not having stable currency. By the time you bring the currency, the goods here, and you sold it, now you have to go and beg the bank again, all your profit and everything is gone. So as long as nothing can be done by the foreign exchange allocation, stable foreign, you don't give loan. Don't give many things. Because by the time the goods are here, it's gone up again. And I want to appeal to some government that, like India and China, to have a special discount for imports from Nigeria, so that we can be able to do something about this foreign exchange.
Thank you.
You understand? So I want to appeal to the Minister of Health, Minister of Industry, that please make a special allocation of dollars for Nigerian pharmaceutical industry, and indeed all other industries. That's all.
Wow, so the man for the vote of thanks is here, so let's hear you now.
Good afternoon. Representative of the Federal Ministry of Industry, here represented, representative of the Federal Ministry of Health, Lagos State Commissioner for Health, the Indian and the Bangladesh ambassadors, the WHO country representative, the DG NAFDAC, DG NIPRID, Chairman PCN and Council, Chairman Council and Hybrid, Chairman Hybrid, Chairman PMG-MAN, colleagues in the industry, my fellow CEOs in the pharmaceutical industry, exhibitors, and visitors here present. I, on behalf of my fellow national service, because when you're in manufacturing industry and you are practicing as a manufacturer, you are actually in national service. On behalf of my fellows in the performance of national service, I say thank you for coming. Enjoy yourself, and God bless you. Thank you.
Thank you very much for that brilliant vote of thanks. The chairman of PMG-MAN would lead the entire delegation, led by the members of the high table, to the exhibition stand to declare it officially opened. All right, so the chairman will lead us. Chairman, where's the way? So we are following the chairman. Members of the high table, please, let's follow the chairman. Is leading us to the exhibition stand to declare it open. Members of the high table, please. Yes. Chairman, where are you? Can you wave? Let's see your direction. Okay, chairman. Yes, that's the chairman, please. Can we follow his lead? Please, let's follow the chairman. So shall we follow the chairman, please? Everybody, members of the high table. I see there's some traffic. Anyway, you're welcome to Lagos. This is Lagos. So to the exhibition stand, please, to the exhibition stand, to declare it opened, to the exhibition stand. Exhibition stand, all right. Exhibition stand, please, can we just move? Yes. Dr. John Alpha, you're expected there. DG of NAFDAC. Professor Mora, please, at the exhibition stand. Well done. Exhibition stand. There you'll be safe from the rain. Exhibition stand, please. Everybody. Exhibition stand. All right, so we are all going to the exhibition stand. Let's go, let's go. This way, Abby. This way, this way, this way. Yes, 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 we're in Nigeria. All right, this way. Minister for Health, Pharmacist Olubumi, Madam. Okay, clear the aisle for the Honorable Minister for Health. And also, Francis Honora, your attention is needed here. We want to cut the tape. Minister, please, siren, where's the siren? Where exactly? Your orderlies and security agency. I don't know, they are not effective. President, PSN. Okay, you want to, Chairman, please. What, should they all come in now or what? Honora Francis, please. All right. Chairman, you want to use the mic?
Yeah, I think so. Chairman, you should use the mic.
You want to use the mic?
Oh, all right. All right. So, distinguished ladies and gentlemen, we have now come to the point where this affair is going to be declared open. And the Minister for Health, ably represented by Director of Food and Drugs, WHO, country head DG, Ministry of Trade and Industry, ably represented by my brother, the Minister for NAFDAC, because she is our own minister. Without her, we are dead, right? So, no worry. You the jealous. No worry. You jealous, my sister. No, no. We don't clap for you, plenty. So, I will now hand over the microphone to Madam Food and Drugs, and the others will please assist her in declaring this event open. Put your hands on the tapes, please, on the tape. Okay. And she will now make a little speech and declare the event open and then feed us.
Yes.
Because she's the minister.
Interesting. So, on behalf of the Honorable Minister of Health, to the glory of God Almighty, I declare this exhibition open for the benefit of all Nigerians.
Honorable Minister, ma.
This is my mic. Your mic. You will now take the shot. Yes.
For real? Despite all the list I have, the errors today don't present you. Which agency be that one?
No, man. He has resumed. You have it.
Well done.
Stand here. Stand here. Oh. Okay. Evans Barrow. Well done, well done, well done. Thank you. Nice. But glucose D. Nice. Well, you should have brought more, huh? Nice. So tell your people, congratulate them. No. So how do you go? No, wala. Right. Okay, my sister. Hey. Unique.
Welcome, Unique Pharmaceutical.
How are you? How is Mr. Ramani?
He's coming tomorrow.
My friend.
He's coming.
That will not.
Yeah, no problem. Yes, sir.
Nice.
Welcome, sir.
Yes, we'll go to Chennai. Nice. Well, because I'm the chairman.
It's
Well done. SKG. Onano, bring takeaway. SKG. Bring takeaway to eat.
machineries and equipment. So we are so very grateful. And we continue to build on that support. Thank you. 85. Yeah. Expansion of the industries. Thank you so much. We're glad to have you around. Make the best use of collaboration. Pharma engineering, quality assurance guarantee.
Because when I came in here, I said, no, I saw actually while I was entering that let me quickly go. So when I got to our interest is local production of everything. And so when we talk to our foreign partners, what we are looking at is having those companies sited in Nigeria and producing those items here in Nigeria. And I can guarantee you that once that is done, we are going to develop policies and programs to support your industry. So that is our position.
Thank you so very much. And we'll tell them that director taking the message back.
I'm Director of Food and Drugs Federal Ministry.
Thank you very much. Thank you very much. is a Swedish company.
Yeah.
Again, project consultant. They are designing.
Enjoying cooperation and collaboration with our industry.
We love to work with the country, and we are already working with a couple of
our industries.
Yes.
Thank
We
you.
are working with Enzor and
I think we're done with this. How far are we still going?
just go.
Locally made.
First exhibition they participated, and now they are looking. Madam, can I have your card? Anything?
No, I don't mind. But you can always get me from the Federal Ministry of Health. I want to sincerely appreciate you for this work. Thank you. Because the concern of the government is geared towards what we are doing. Local production. You need our help. See us on the 10th floor, Federal Ministry of Health Secretariat. Tell us what you want. We will always help you in terms of policies and programs to protect your industry.
I will take my numbers. You get it.
Thank you so much. Thank you.
I don't know what
I'm preparing for the main job. No, sir. I'm preparing for the main job. Okay. Yes, is this Frank's stand? Yes. Okay, what's Frank?
We are into market access.
Market access.
Policy
Sorry,
sir.
Yeah. You? Yes. You are taking my job? Yes. Okay. I don't mind. I will recruit you. Since I've seen that you have the what it takes. Come on, please go.
Where my people are done? Okay, sir. Okay. More. Thank you.
Honorable Minister.
So, good afternoon, everyone. My pleasure.
They are into blister packing machines. Yeah.
Okay, blister packing machines. Is your industry here in Nigeria? Here in Nigeria or you are...
In Mumbai, yeah.
Sir. Now, my concern is how can this industry
take the photo? We are from Ivory Coast. We are from Ivory Coast.
Currently, we have issues with forests.
Madam.
And so when we say we need these plants, we do not have forests like this. But if it's locally manufactured here in Nigeria, we don't be talking about forests. So we are looking at all these industries. How can they move? How can they be cited? And I can assure you from the government perspective, we support you with policies. The door is open for everyone to come in and discuss on how this industry can move up to the system. COVID has taught us that once we are so we're glad to partner with some of our businessmen, set another plant. And that plant may be surprised. Right, to supply to all of us.
For Finnish components, yes, we can understand. But machinery is very difficult.
Why would it?
It needs a lot of supporting.
Okay, which we don't have.
Yeah, when I am manufacturing a machine in India, I've got more than 50 supporting suppliers for me who do certain jobs for me. Even in India also, it's everywhere there. No.
where all the ancillaries are there. Because everything is not done performed by
So
them.
you support us to develop our own
No,
system.
like this company, like they started the
Because they are in consumers. The packaging item.
here, suppose they have to make the machine and they have to polishing from the outsource, buffing from outsource.
So many raw materials they have to get, all imports.
And then technical manpower, skill power.
We have to start from somewhere.
That's why they.
If we continue to look at the challenges, we will never start.
They came first time as an exhibit like this, and today they put up like that.
Thank you. So we hope that we are also looking to Hello, madam. You're welcome, my friend. We want to take a photo. You want to take a photo? Okay, no problem. Let's take a picture. Thank you. I knew it was me to do that. I was waiting. How are you doing, man? How are you falling? So nice to see you. How are you? Okay. Sure. Right. You shifted from Lagos to Abuja. Big man. You've gone to the capital now. Hello, madam. How are you? I'm fantastic. My name is Ram. He's from India. You know him last year, 2 years ago. And he has not done something in Nigeria. They don't allow me to do for them. Why? See? I have my, see that place? For the muffin manufacturing. I will give it to you. Come, let's discuss. Come, let's discuss. Come, let's discuss. That's me. That's you too. Develop your business together. I will do that. I will do that. With pleasure meeting. Okay. However, implementation has always been this is actually the number of documents we have at which are not advocacy, we are not advocacy.
And you have to select that. You need to select
Tàbí ó máa ti ń pín jẹ ló bá ní kí n wá.
And they said, okay, from here,
and discuss with you so that you guide us. Because what we need is guidance. We need that guy. And we are saying that because we feel that dollar is a challenge and there's no end to it, let's do everything local and support people for this. Support. That is why we have you people there. I'm not this man over time. So we work with them. We need to learn. Yeah, before they were doing the event, I know him for more than 21 years. Yeah, I know him for over 30 years. Since I graduated, he doesn't know me, but I know he refused to post me. I saw back at 91. Then I was attended family. Check your records. Well done. My classmate. My classmate. Thank you. You did very well. Thank you. You're welcome. Where your stand? Don't take stand. Don't take stand. I don't get money. Everything is yeah, the country, yeah, everything was very short. Yes, sir. Yes. You people are not seeing us. We are seeing you. The wedding is back in the market. What is the
We're done. Our guests need to go and get.
Okay, so now we can go. What do you want to ask? Nobody goes by the show you to give. After they have one can follow you. But just have to say you're not carrying all the food because that's great for you. Esa. Wait. I will come like this first.